offer you. We work with Head Starts and preschool on up. And so if you ever need anything, feel free to reach out to us. We are available. And we do try to work with the schools, but sometimes we don't always get in the right doors. But if you are here and you're from a school and you want us to come in, you just reach out to us and we'll make it happen with you. Because it's very important that we have these conversations with our parents, with the children, with the administrators. So we can do PTO presentations, we can do them, we can arrange for programs with children and youth, and we can talk to the parents as well and the administrators. So please don't hesitate to grab one of us or take our cards. We have much information out there on the tables. And I'm going to just put a side plug in for myself. There's an activity on my table right now, and it's writing a letter to the governor. So there's notes provided. I will mail them. But we are in the process of doing an urgent push to let him know that we want him to take the health of our residents and make them a priority for public health. So we're encouraging him to promote anything he can with public health, especially with trying to raise the cigarette taxes and to promote things that we know are evidence-based that can help us lower the rate of smoking and tobacco use in the state. So please take the time to do that. You'll see the sign on my table that says stop, and it has the notes and an empty basket with no notes in it. So please consider writing a note, and I will send those off tomorrow. So the Tobacco-Free Lake County, Indiana Coalition and the Tobacco Education and Prevention Coalition for Porter County, which is based right here in the Valparaiso University College of Nursing and Health Professions, we both have many efforts that we work on to help our residents live, work, and play in smoke-free environments. Our staff and our coalition members spend countless hours defending our right to breathe clean air and to help residents avoid tobacco and nicotine-related physical and mental health issues. We work with school corporations, healthcare providers, healthcare organizations, employers, organizations that serve marginalized populations, and we want to ensure health equity among all of those populations. We work with multi-unit housing, we work with universities, youth groups, Head Start programs, and other preschool programs. We work with the media, and we work with our local coalition partner organizations as well. The information we're about to discuss is just one of the many efforts that we are charged to work on, but it is one of our most important efforts, defending our youth and our young adults against manipulating attacks from the tobacco industry. Some audience members today are from Lake and Porter counties here in what we call Northwest Indiana region, while many of the college students today may even consider another state, county, or even country their home. Regardless of where you're from, the tobacco industry targets youth and young adults to cause that addiction to vaping and other smoking products. Big Tobacco is desperate to use each young person as a replacement for someone who has quit smoking or has died or is dying from smoking-related diseases. While the statistics and information you hear today pertain specifically to Lake and Porter counties, the message is the same across the country or even globally. The tobacco industry must be stopped in their efforts to lure our youth and our young adults into a life of addiction to vaping nicotine, which can be very quickly and very often lead to smoking or vaping marijuana, which has proven to be potentially a result that results in future addictions like Dr. DeNoble just talked about, and physical and mental health problems down the road. Today, our Porter County Voice Youth members, Lauren Jeffries and Caden Haratos, along with the Tobacco Education and Prevention Coalition for Porter County's very own youth facilitator and outreach specialist, Emily Carpenter, will provide you with the information you need to set the stage for our community conversation that follows this particular presentation. So they're teeing it up for the conversation we're going to have. The local and recent point of sale assessments conducted by our coalitions this past spring illustrate the current status of how local youth are being targeted right here in our very own counties, as well as across the country. Now I'm going to turn it over to Emily, Lauren, and Caden.
Yay. Thanks, Carrie. As she said, I'm Emily Carpenter, the Youth Facilitator and Outreach Specialist, and our other presenters today are our Porter County Voice Youth, Lauren and Caden, and I'm going to just shoot it to them right now.
Okay, so over time, the way tobacco companies market their products has changed. The pictures you see on the left are just a few examples of what tobacco marketing used to look like. Tobacco companies used to have cartoon characters like Joe Camel, which directly appealed to kids, and they used to give away branded gear like t-shirts and hats. They also used to advertise on billboards and sponsoring sporting events. As tobacco advertising has been restricted, tobacco companies have had to adapt and change the way they market their products. Now, instead of billboards, sponsorships, and branded gears, tobacco companies spend most of their time marketing dollars at the point of sale. In other words, in stores where tobacco is sold. The picture on the right gives a snapshot of what point of sale tobacco marketing often look like. So what is point-of-sale tobacco marketing? Essentially, it is a marketing tobacco products to consumers where they purchase tobacco in retail stores such as convenience stores or gas stations and grocery stores. Point-of-sale marketing includes things like price promotions or discounts on tobacco products, in-store tobacco product displays, product placement, and retail advertising. It's also important to keep in mind this type of marketing is not random. Retailers often have contracts with tobacco companies that specify where tobacco products have to be placed, at what height, and what proportion of the display needs to be dedicated to particular products. It is also a very intentional form of marketing, and tobacco companies know how it works. Tobacco companies also invest heavily in point-of-sale marketing tobacco. In 2020, tobacco companies nationwide spent $8.4 billion on tobacco marketing, over $1 million per hour. About 89% of that was spent on point-of-sale marketing. In Indiana, tobacco companies are estimated to spend about $284 million marketing their products each year. This equates to $42 per Hoosier annually. So why does point-of-sale tobacco marketing matter? The reason why tobacco companies invest so much money in point-of-sale tobacco marketing is because they know how much it works. First, point-of-sale marketing has shown to increase the likelihood that the youth will start using tobacco and progress to regular tobacco use. This is very important for tobacco companies because about 9 in 10 smokers start by the time they turn 18, and about 99% start by the age 26. Tobacco companies know that if the young people don't start using tobacco early, they likely never will, and maintaining a base of youth and young adult smokers is crucial for sustaining their business. Second, point-of-sale marketing makes it more difficult for tobacco users to quit. Research has shown that tobacco users exposed to point-of-sale marketing may experience more tobacco cravings, are more likely to make impulse buys, and less likely to successfully quit. Point-of-sale marketing therefore contributes to keeping current tobacco users addicted and to using tobacco. Finally, point-of-sale marketing disproportionately targets some communities. In particular, this type of marketing often targets communities with a high proportion of low-income or minority residents. Often, these groups are already disproportionately impacted by tobacco, so point-of-sale marketing contributes to disparities in tobacco use and tobacco-related diseases.
All right, so we know that the tobacco industry spends most of its marketing dollars at point of sale, and that point of sale marketing increases youth smoking, makes quitting tobacco more difficult, and contributes to tobacco use disparities. So now I'm going to shift and talk specifically about the tobacco retail environment in Porter and Lake County. When we study the tobacco retail environment, we often talk about density and proximity. Density is a measure of how many tobacco retailers there are in a particular location. In this case, we measure density as the number of retailers per 1,000 population. Proximity is a measure of how close a tobacco retailer is to another location, such as a school or another tobacco retailer. As you can see here, there's a large number of licensed tobacco retailers in Lake County. But generally speaking, Porter County has slightly lower than the statewide density, while Lake County has a slightly higher than average density. Retailer density isn't uniform, though, and they tend to cluster around each other. About half of all tobacco retailers are within 500 feet of another, and in these areas, smoking is more prevalent. In addition, it's important to look at the location of retailers relative to schools. Research has shown that youth smoking prevalence is higher in schools in areas with higher tobacco retailer density. Additionally, when retailers are located near schools, students may be more exposed to retail tobacco advertising. Lake County has twice as many retailers within 1,000 feet of a school compared to Porter County. These maps show tobacco retailer density by census tract. Blue is the lowest and red is the highest. Red areas have more than one tobacco retailer per 1,000 population. These are referred to as tobacco swamps because of the high density of tobacco retailers. It is important to pay attention to this since smoking prevalence is higher in these areas, as well as more prevalent in areas with lower median household income. These people are often already disproportionately impacted by tobacco use. It is important to understand what types of point-of-sale marketing are common among tobacco retailers. To do this, we collected standardized assessments of point-of-sale marketing in tobacco retailers. Porter and Lake County were 2 of 39 counties statewide where tobacco retailers were randomly selected to be assessed. The assessments were completed using the Standardized Tobacco Assessment for Retail Settings, or STARS, way easier to say, developed by state and community tobacco control researchers at Stanford and other universities. STARS has been used to assess tobacco retail marketing across several states and includes questions about tobacco product availability, price and promotions, and tobacco advertising. Overall, 2,985 assessments were completed across the 39 Indiana counties between February and April 2022. The largest proportion of stores that were assessed across all counties surveyed were convenience stores. We surveyed liquor stores, mass merchandisers such as discount stores, grocery stores, tobacco shops, pharmacies, and other retailers. Here you can see the breakdown of the types of stores that we assessed. As you can see here on this chart, nearly all of the retailers surveyed in Porter County sold cigarettes or menthol cigarettes. All retailers in Lake County sold menthol cigarettes. You can see the amount of other products we found too, and we'll talk later about the importance of those menthol cigarettes. In addition to assessing product availability, we also collected data on retail tobacco advertising placed outside of a store. This includes advertising like those in the pictures shown here, such as signs on building walls, in windows, or on gas pumps. This type of advertising is important because people don't even need to go into a tobacco retailer to be exposed to tobacco advertising. For example, kids can be exposed to these ads in a car while their parents are purchasing gas, or simply walking past tobacco retailers in their neighborhood. Even driving by, sometimes you can see them. In Porter County, we saw that nearly 3 in 4 retailers surveyed, and Lake County, we saw that about 3 in 5 retailers surveyed, they displayed some form of exterior tobacco ad. In general, the most heavily advertised products were cigarettes and menthol cigarettes, followed by smokeless tobacco and e-cigarettes. Overall, these results suggest that exterior advertising is quite common among tobacco retailers. And I hand it back to you, Kaden. There you go.
In addition to exterior tobacco advertising, we assess products and marketing tactics that specifically target youth. In particular, we assess the availability of flavored tobacco products. Although flavored cigarettes other than menthol have been banned in the U.S., other products are available in a wide variety of flavors, like e-cigarettes. Often, these are sweet candy or fruit flavors that have been shown to appeal to the youth. These pictures show cigar brands that are popular with youth and available in a wide variety of flavors like grape, cherry, strawberry, and chocolate. You'll also notice that these products are often cheap. In the pictures here, they are 2 for 99 cents, and they are often available in brightly colored packaging that may appeal to kids. We also know that the majority of youth who use tobacco use flavored products. Research has shown that most youth have tried tobacco first, tried a flavored product, and youth often indicate that the flavors are a reason for using tobacco products. What we saw from our store audits was that flavored tobacco products were very commonly sold. Across all counties surveyed, more than 9 in 10 tobacco retailers sold any flavored tobacco. This data indicates that the flavored products are widely available. We also know that flavored products appeal to the youth. This slide shows flavored product availability among retailers that sold various types of tobacco products that are often manufactured in flavored varieties. Over 9 in 10 tobacco retailers sold flavored varieties of these products. Ultimately, these results demonstrate just how widely available flavored tobacco is across retailers in Porter and Lake County in Indiana. It is important to take a little more time to talk about flavors, including menthol, and how it impacts our communities. We have seen how widely available menthol products are. In the following slides, we will cover how flavors, including menthol, are marketed and which communities are largely impacted, the history of menthol, and how it's still around after the flavor ban, the steps we can take to support the ban, and the situation in Indiana. We talked about youth targeting and how flavors including menthol are marketed towards youth. In addition to youth, flavored products, specifically menthol cigarettes, are targeted to other sectors of the community. Menthol is largely marketed towards our marginalized populations, including those who are African American and those that identify with the LGBTQ community. The commercial tobacco industry has spent decades targeting African Americans into a lifelong deadly addiction. Advertisements both inside and outside stores were 10 times more likely to be present in their neighborhoods. In addition, we see rates of increased use of menthol cigarettes among those that are a part of the LGBT community compared to those who are not. Because menthol masks the deadly toxins in cigarettes, many menthol smokers are now likely to attempt to quit smoking if menthol cigarettes were banned nationally. A menthol ban won't solve, but it will help mitigate some of the disparities in health outcomes. Commercial tobacco manufacturers have used menthol cigarettes for years to target vulnerable populations. In fact, according to national surveys, menthol cigarettes are the source of addiction for nearly half of all teen smokers. Menthol increases the palatability of smoking, especially among young and members of racial and ethnic populations. And menthol increases the difficulty of quitting. Yet when Congress prohibited most cigarettes with flavoring as a part of the 2009 Family Smoking Prevention and Tobacco Control Act, it exempted the most important flavoring of all, menthol. You can see the timeline here where the Tobacco Products Scientific Advisory Committee tried to make headway but was resisted, making it difficult to address menthol. What is menthol and why is it added to tobacco products? Menthol is a flavor additive with a minty taste and aroma that is widely used in consumer and medicinal products due to its reported cooling and pain-killing properties. When used in cigarettes, menthol may reduce the irritation and harshness of smoking. Flavored cigarettes are heavily preferred by both youth and young adults. This was seen in a recent study where more than 80% of those ages 12 to 24 that smoked reported using menthol cigarettes. Additionally, when looking at any flavored tobacco use, 80% of those 12 to 17 using tobacco are using a flavored product. Flavors are commonly a reason cited for using tobacco products.
Thank you. Ooh. What does menthol do other than reduce the irritation and harshness of smoking? Menthol facilitates initial use of tobacco products because it makes it easier, deepens addiction, increases dependency, and suppresses sensation. When waking up, people who use menthol are more likely to wake up and immediately use than those who do not. Menthol can also cause more withdrawal symptoms, and industry documents point to studies on manipulating menthol to promote addiction. Overall, menthol makes it easier to start and harder to quit. We know stores sell these products because youth like the flavors. We've talked about that multiple times today. In 2018, we asked middle school students and high school students in Indiana why they chose to use cigarettes, and the most common reason was because of their availability in flavors. We know that retailers sell a variety of flavored products, and we can see from this slide that youth are using a variety of flavored products. As noted before, nearly 3 in 4 middle school students and 4 in 5 high school students who use tobacco are using flavored varieties of these products. E-cigarettes remain the most popular flavored product used, but menthol cigarettes are also largely common among youth. When we talk about flavored products, we need to always include menthol. It should be noted that like candy, fruit, or other flavors that are used to target youth, menthol has a history of being used to target not only youth, but also specific adult communities. In Indiana, we have seen that youth use menthol cigarettes, but also adults, specifically those who are African American or members of the LGBTQ+ community. We can see here that nearly 90% of all African American adults that smoke are smoking menthol cigarettes. So where are these menthol products being sold? Basically everywhere. Well, we saw in Porter and Lake County that nearly all tobacco retailers sold menthol cigarettes, similar to what we see across all of Indiana, indicating that these products are readily available. Additionally, we looked at disposable e-cigarettes, which are popular among youth. In Porter and Lake County, among retailers that sold disposable e-cigarettes, 9 in 10 sold the menthol variety of this product. We also know from collecting this data that advertisements for menthol cigarettes is quite common. Advertisements for menthol products were seen on the exterior of more than half of tobacco retailers in Porter and Lake County. This means that even those that do not go into those businesses are being bombarded with these advertisements. And like I said earlier, it could be adults, it could be children in cars, it's everybody.
So, what are the calls to action for our community? State and local communities should continue to prohibit sales in their jurisdictions. We need to monitor FDA actions and provide feedback on proposed rules. There needs to be support for tobacco treatment, such as the 1-800 Quit Now hotline, and we can combat misinformation and industry attacks by educating ourselves at events such as this one. Here are some key partners with us. As you can see, we have a lot. In addition to flavored products, some tobacco marketing tactics, such as the price and placement of tobacco products, particularly target youth. Youth are a very price-sensitive population. They often don't have a lot of money to spend on tobacco products, so cheap products tend to appeal to them. Often, tobacco products such as cigars are priced much more cheaply than cigarettes, available in a variety of colors and sold in multiple units per pack. Here you can see pictures of just how cheap some of these products are, as the pictures on the left show cigars priced 2 or 3 for 99 cents. Tobacco products and tobacco ads may also be placed where they are highly visible to kids, such as at the child's eye level or near candy, soda, or toys. In the middle picture, for example, you can see e-cigarettes placed on the counter near gum and candy. These types of marketing tactics were fairly common among retailers surveyed. Nearly half of retailers in Porter County had tobacco ads placed within 3 feet of the floor, and a third of tobacco retailers had tobacco placed within 12 inches of kid-appealing products such as gum. Additionally, nearly 9 in 10 retailers in Porter County and Lake County sold single cigarillos. This indicates that these products are often sold at very cheap prices, which makes them more accessible to youth. It's also important to remember that these products are often available in flavored varieties that directly appeal to young people. Finally, we also collected data on price promotions on tobacco products. Price promotions are important because they represent the largest category of tobacco point-of-sale marketing. Tobacco companies spend more on price promotions than any other type of advertising, and it's such an important part of their marketing because one of the best ways to reduce tobacco consumption is to raise the price of tobacco products. Tobacco retailers, therefore, offer price discounts to appeal to consumers and offset tobacco price increases. These pictures show examples of tobacco price promotions such as coupons. Retailers may also offer multiple pack discounts, such as the picture on the right that shows cigarillos advertised as buy 10, get 1 free. Overall, it was quite common for tobacco retailers in Porter and Lake County to offer price promotions. 68% of tobacco retailers in Porter County and 57% of tobacco retailers in Lake County offered promotions on any tobacco products. This was slightly higher than what we saw across all counties. Among retailers in Porter and Lake County, we saw that price promotions were most commonly offered for menthol cigarettes. Overall, this data indicates that price promotions are a fairly common marketing tactic among tobacco retailers in Porter and Lake County and across other counties in Indiana. We also gathered data on the price of specific tobacco products. You can see the table here and the disparities between Porter and Lake County, as well as the average across all counties. For example, in Porter County, the average cheapest price of a pack of cigarettes was $5.68, slightly higher than the all-county average of $4.85, but still relatively cheap, probably about what you typically pay for a grande latte at Starbucks. The key takeaway is that cigarettes and other tobacco products are still available at relatively cheap prices. Ultimately, this makes tobacco more accessible to consumers, and particularly to price-sensitive individuals like youth and low-income adults. So what are the overall takeaways of what we know about point-of-sale tobacco marketing? First, we know that the tobacco industry relies heavily on point-of-sale tactics to market their products, spending 95% of their annual marketing budget on point-of-sale marketing. Second, we know that point-of-sale marketing encourages youth to use tobacco, makes quitting tobacco more difficult, and disproportionately targets some communities, which contributes to disparities in tobacco use rates and tobacco-related health outcomes. Finally, a high proportion of Porter and Lake County tobacco retailers engage in point-of-sale marketing tactics, include displaying tobacco ads, engaging in price promotions, and promoting cheap, flavored, youth-appealing products. CDC's Office on Smoking and Health, in collaboration with the University of North Carolina at Chapel Hill, recognized the retail environment as a key component of effective tobacco control efforts. This is what they have to say about what they found. The retail environment is used heavily by the tobacco industry to promote and advertise its products. It is therefore also an essential environment for further reducing smoking, as well as improving racial, ethnic, and socioeconomic tobacco-related disparities. This commentary provides an overview of the importance of incorporating strategies focused on the tobacco retailer environment as part of a comprehensive approach to tobacco prevention and control. To reach tobacco endgame targets, such innovative strategies are a complement to, but not a replacement for, strategies that are long-standing and have been shown to be effective. Smoke-free policies, tobacco price increase, media, access to cessation.
So what can we do about all of this? That's a lot of information I just gave you. It's a little overwhelming, right? Well, unfortunately, in Indiana, there's preemption on regulating tobacco retail at the local level. This means that only the state General Assembly can regulate the sale, distribution, or display of tobacco products. And local governments cannot enact their own regulations on how tobacco is sold, distributed, or displayed. That doesn't mean that nothing can be done, though. Don't be discouraged. The first step towards changing any policy is building grassroots awareness and support, and that's where we need your help. You can help raise awareness of point-of-sale tobacco marketing by sharing this information with others in our community, particularly people in your sphere of influence, like coworkers, peers, family, friends, and others. You can tell people on the street if you want to. I do sometimes for fun. You can also join our coalition if you want to be involved in a more organized way. You can join Voice if your age is 13 to 18. Talk to me. Or if you have a teen that you know that might be interested, also talk to me. You can stay connected so we can help you stay up to date about local and statewide tobacco control issues. This helps make sure you have an opportunity for your voice to be heard about a whole range of tobacco control issues. Finally, you can always partner with others in our community to help build healthier environments where we live, learn, work, and play. This might be by partnering with a neighborhood association, local schools or universities like Valpo, parent groups, youth serving organizations, the faith community, and many others. Many voices are stronger than one, and building these partnerships helps build the grassroots support we need to protect our kids and families from tobacco and make our communities healthier. Thank you. Also, you guys did a great job. Thank you, guys. You're amazing. So what questions do you have? Any questions? Sure. I mean, you're loud, right? I'm loud, too. I don't need a microphone.
Specifically for the youth, so how do you believe your peers are getting e-cigarettes and tobacco products? So obviously, they're probably under the age of 21.
I'd say a lot of like older friends and siblings I know are buying for people who are younger than them. Sometimes parents, which kind of sucks, I've seen before, but usually it's older siblings or peers who are older than them.
Anybody else have a question? Great question, by the way. It's literally insane. Sometimes we see that parents will buy them for the teens. They pass them out at slumber parties. They give them cases to sell at school. It's a little outrageous here that happens, but good question. Anybody else? You have another question? Okay.
So, let me talk. I can just yell. So, okay, I'll talk into the mic. So there was a pretty large discrepancy between the number of retailers in Lake County versus Porter County. Can you share a little bit about that, and why is that the case?
Let me find the slide real fast. The number of tobacco? This one?
Yes. Yes, so 538 and 126 is pretty big difference.
That is a pretty big difference. I don't know if I'm equipped to answer that question, if I'm being honest with you.
Size.
Size. It's so much
just-
bigger there. There's a lot more space.
We actually went to 135 places, but sometimes we don't get complete information and we couldn't. But that's still way less than Lake County's 538, which they probably had an even higher number that they went to as well. But we're just a little bit smaller, yeah.
Yeah. She's coming.
Just the density is what you look at, because obviously Lake County is a lot larger than Porter County, and that accounts for most of it. But the density, if you want to talk about, you can say the density of providers, 0.8 versus 1.1. That's the proper comparison.
Yeah. And they're in like we're about average. I mean, 1 is the average, right? Or 0.9 is the average in Indiana. So Porter County is about that average. Lake County is slightly higher than that, so they have more of a density in that area. Anybody else? You again?
I'll ask another question. So this is for the youth. So, you go to the same school. So do you have tobacco retailers close to your schools and close to other places that your friends go to? So whatever you like to do for fun, or your house even.
Yes, I would say that we both go to Boone Grove High School, and I would say within 5 minutes of the school, it is pretty easily to get access to any type of product that you're looking for.
And do you know of specific, so follow up and you can answer both, do you have specific retailers here? So I'm from Kosciuszko, and so my son Cayman's going to be speaking later, but we have specific retailers that the youth know those retailers are going to sell them tobacco. So do you know from your peers if there's specific retailers in Lake and Porter that are known to sell to young people?
I know that a lot of people used to go to the Tobacco Island that was like by like the Smoothie King and Crown Point or whatever, but they started shutting that down. I know because like people would be like, oh, like the cops are waiting outside. I remember hearing that. I know there's a few other places, but there's definitely a lot that they'll know and they'll go to because they know that they won't card. And sometimes like it's just if you have an account there or if like they won't even look, which it sucks because that's so easily for kids to get it.
And I think there really are just like hot spots in general. People gravitate towards the same area, and once one person finds out that they can easily get a product one place, then it can spread. Especially, we go to a very small school where there's about 100 kids per class, so it's something that definitely gets around.
We have an issue here in Porter County right now where there's a vape store that popped up in May right across from Willow Creek Middle School. And it's breaking the Indiana code, and it's being investigated as to what's going on. I've had a meeting with the mayor. That's a big issue. If you could literally throw a ball and hit that vape shop, which has a giant bong in the window, and they said the biggest problem they have with it is there's lights around the windows that they don't like. Well, we don't like it facing the school or being close to the school, so we're working on that with prosecutors and excise and everybody else. And the mayor is totally against it, wants it gone, trying to figure out how that happened. But, you know, we see that happen. And there's enough marketing on the way to that school. The gas stations are just littered with the doors, the windows, the kiosks over the poles that protect the store. It's ridiculous how much marketing they put.
I don't have a question, but I'm from Lake County. I'm a part of their voice team. And I know at my school, I go to a small school. My class size, there's only about like 105 people. And like during practice, like kids will like leave if they have maybe, 30 minutes before a game. And they'll go like walk maybe like 4 minutes and they'll get tobacco products and bring them back, hide it in their gym lockers. Wow. And that's just crazy. I mean, those are athletes. They're supposed to demonstrate good behavior, and they're putting it in their lockers, and it's so easily accessible for them. Yeah.
As somebody who went to Willow Creek Middle School, I know definitively you can see that sign from inside the gym. So those kids are looking at that like daily, which is outrageous to me.
First of all, I want to commend all our youth that are speaking, because a lot of the adults in the room want to hear your perspective. So, thank you for sharing today. I would like to discuss the slide with flavors, and just get your perspective about your peers on how the importance that flavors play a role in, the introduction of vaping. And then twofold, you have a lot of community members that work with youth and young adults. And so what would be a key message that you think from a youth perspective that you could give some of these adults? So twofolds, just talk about the flavoring and how that introduces your peers. And then secondly, what would be a message for all these community members to go back and share?
I think the whole flavoring thing kind of goes hand in hand with like how it does with alcohol, because kids aren't going to want to like have something that tastes bad like just for it. So like if it tastes good, that's like, and they're like, oh, it looks fun, or like somebody else is doing it, that's not going to stop them, because they're not going to do something that tastes bad like right at the beginning. But if they get introduced to something that tastes good and they start craving it, they're not going to care how it tastes after a certain point. I don't know. I'm going to have to come back for the message, but I'm going to hand it off to Lauren.
I definitely think that the flavoring is the main draw to kids, students our age. They're looking for something that's fun and something that'll get them feeling a little bit less stressed out in life, and this is just really a good outlet to them. I would say that a good message is a lot of people look to a certain type of group, to the students they think are doing these products, when I really think, being in the school community, that there are so many people. I would say probably 75% of the students at my grade have at least tried some of these products. And I think that more so the prevention is targeted towards students that fall into certain groups. And I think that then that allows some of the other students to more easily get away with it. Like you had said, student athletes, they're supposed to be these perfect, like, follow this certain type of whatever, and I feel like that most people overlook that, and I can just personally say that I know a ton of people who the school looks at as being the best type of people, and really they are using.
I think that's really interesting that Lauren brought that up, because I just was looking at some research, and I saw the research say that one of the mistakes that schools are making is they're trying to pinpoint the group of kids that are vaping. There is no vaping group. I guess if you're a vapor, then you're in the group, but they can't target strictly athletes. Or, back when I was in school, you were an athlete or a stoner, or, there was specific categories, and you kind of fell into at least one or two of them. Now, no, it doesn't matter. Any kid can vape. It doesn't matter if they're an athlete or a scholar or what they are, but the research is showing they're vaping universally.
So I'm an SRO from Hobart High School, and I was just, since I have a chance to ask some students who are knowledgeable about this, how do you feel your school's efforts to combat tobacco use and vaping are? How effective are they? What would you like to see them do differently? I know we mentioned about not targeting groups, but it gives me a chance to actually speak to young people and get some feedback.
So our school, usually a lot of the kids will go into the bathroom to vape because it's like easy, but our school this year put up vape detectors, and within like the first day they like were able to catch like 7 kids, and they got like, I know, like a gallon sized bag and like another half of the gallon sized bag of products like vapes, marijuana vapes. I know they got that. So it's been a lot more effective to at least keep it out of the school, which is good. I mean, I know they're not taking it away completely, but their efforts are there. And I do think that they really do try and like, they act like kids won't, like good kids or like student athletes won't do it, but they do. And I mean, even like, I don't know. Sometimes I think that the like drug testing isn't like random when they pick it, but that's besides me.
I think that, like he said, the vape detectors are definitely an effective approach, but I think there are certain things that honestly, I feel more promote kids even. We have some posters around our school that are on like the bathroom doors, and it's almost become more of a joke with students. They like to like make fun of certain things, and I think that mainly the most effective way is to start within. For example, Kate and I being a part of this, I think being youth, talking to other youth, spreading that message amongst our peers, that's the way to combat the issue. Then I feel like we all know that high schoolers are sometimes rude and they like to mock and mimic, and I think that these posters or certain advertisements around, they, I don't know, make fun more than follow them.
I can tell you from experience in working with the schools and talking with Kaden and Lauren, and talking to students after I give a presentation versus when they give a presentation, they listen so much more when they speak than when I speak. They're like, oh, that's another adult, whatever. It's like la la in one ear, out the other. And when they speak, they're like, wow, I didn't know that. I'm like, I just said that. But that's fine. It's cool. Don't listen to me, but listen to them. So the peer-to-peer thing is probably the most effective, at least that I've found working in this position about a year. So you want to move to the panel now?
Sure, but that's why we push so hard to have students work with our youth facilitators and with our tobacco coordinators so that we can have youth like these in the community to snowball and build that up. We try to get representatives from every school system in our county to participate, and it's very difficult for them to we even try to get them to elect a couple students per school, knowing that if we can get a couple students in each school, it might snowball there. But we need your help. If you're educators, please, help us try to figure out how do we work within the channels within your school system to get those couple students who could help us grow our program throughout the county and be the voice that comes back to your school to educate your own youth in your schools. But then we're more powerful, they're more powerful, their message is more powerful if we can grow this group. But it's very hard to kind of get it going within the schools or within youth groups, even churches. We have pounded on doors of churches, and they all say, yeah, that sounds great, and then we hear crickets, nothing. So if you can reach out to one of us, if you're in one of our counties, we would love, Emily would love to hear from you. We would love to come in and talk to any honor society, youth group. If you're giving points for service, some schools are starting to give service now, points for service hours. We would love to work with students and even maybe just collaborate on an effort or an event that your school's already doing so that we could have discussions with the youth and let them know what we're about. So they could talk to Emily, Irene, or I to get that set up. So we would love to have your support with that.
All right, thanks, guys. I'm going to move to the next thing. So the next thing we're going to be doing is a panel discussion. The youth are going to lead this. We have some awesome community leaders joining us today, but first I'd like to introduce the youth that are going to take over for this section. Mika Neely, she is a Voice Corps team leader, and Cayman Blake is a Tobacco Free Kids ambassador, and they'll be moderating this discussion. So you guys want to join me up here, or just you, I guess, if you guys want to pop down. I'm going to introduce these leaders that are going to be part of the panel if you want to come on up. First we have Risa, I hope I'm saying that correctly. Yay, thank you. Ratney. Mrs. Ratney is a public health administrator with over 25 years of experience in maternal child health programming. She is currently working with the Northwest Indiana Health Department Cooperative to coordinate the activities of the Lake County Fetal Infant Mortality Review Program. She also serves on the board of directors for Community Health Net, Health Centers, and the 16 Pearls Foundation. She is an active member of several community-based committees and initiatives that focus on improving health and well-being. During her personal time, she enjoys gardening, bike riding, walking, and strength training. Same, also. That's amazing. Next, we have Eric Evans. Mr. Evans is a certified prevention specialist and serves as the director of prevention services at Geminis Corporation. There, Mr. Evans provides oversight to multiple grant-funded funded initiatives focusing on suicide prevention, mental health promotion, substance misuse prevention, LGBTQ plus competency. Mr. Evans provides training to local school districts, community stakeholders, social service agencies, and throughout the United States. The most important role for Mr. Evans is that of father of his 2 young kids. Then we have Stacy London. Mrs. London is the statewide youth coordinator with the Indiana Department of Health, Tobacco Prevention and Cessation Division. She has embraced the mission of engaging, educating, and empowering young people as leaders and advocates in their communities. Key to this task is developing youth-adult partnerships, positive youth development, and public health advocacy training, which she has done with me. She's amazing. Thank you, Stacy. Mrs. London enjoys spending time with her family, and she loves to make pies. Her specialty is a derby pie, reminiscent of her home state of Kentucky. I didn't know that, but I'd like a pie now. And Dr. Richard Hugg, PhD, has spent many years dedicated to improving the quality of life in Northwest Indiana. He has been a strong advocate for marginalized communities, children, and underserved families. Dr. Hugg has contributed countless data analysis on environmental and health conditions in Northwest Indiana that enhance the work of many local community programs. To this day, even in retirement, Dr. Hugg finds ways to continue his dedication toward Northwest Indiana, and there are many of us who are grateful. I'm so grateful for this whole panel. You guys sound amazing. I'm so happy you're here. Thank you so much.
I'm Cameron Blake. I'm a Campaign for Tobacco Free National Youth Ambassador. I go around the state, trying to go around the nation sometimes too. I've been to DC and the State House multiple times trying to prevent tobacco getting in the hands of youth and make sure it's being used responsibly by adults. I've helped get Tobacco 21 passed and attempted to get the tobacco tax raised in Indiana. I'm motivated because when I was in the 2nd grade, my grandfather died of cancer due to smoking.
Hi, everyone. I'm Mika Neely. I'm a junior at Edison and Lake Station. I've been with Voice now for about 5 years, and I've been the president for 4 years? 4 or 3 years now. It all blends together after so long. What really drew me to getting into Voice was I saw an issue with my peers. I saw how vaping and nicotine and tobacco products were getting in the hands of my youth and how it was affecting them. Athletes, it was making them, they had those nasty coughs. And I just saw how students, they would be vaping in the back of classrooms instead of paying attention to their teachers. Their grades slipped. They were so focused on getting their fix in for the day and not to their classwork. So I decided to step up. I have a voice. I feel the passion to use it, to step up and help educate and empower my fellow peers against the harmful tobacco products and nicotine, and just help them out, help educate them. So hopefully you enjoy our panelist discussion.
In the last presentation, we heard about the impact flavored tobacco has upon marginalized and minority groups all around Indiana. With the current movement to remove flavored tobacco products, including menthol and vape products, from the market in an effort to protect our youth and our generation from the huge cause of death that is tobacco use, would you agree, panelists, would you agree that we should expect the FDA, state, local, and federal governments to do more to save lives and support policies that protect all people? We don't have a mic up here. Test.
Thank you. Tell me your name again.
Cayman.
Okay, all right. All right, so the question was, should we expect the FDA and...
Local, state, federal governments to attempt to protect our youth?
Oh, absolutely.
Products of tobacco.
Absolutely, I think you should. And this is a wonderful platform for you to begin that type of advocacy around this issue. So yes, you should, and I think we'll probably talk about maybe some ways to do that, but yes, that should be your expectation. Now, that's not to say that it will be easy, but it should be your expectation.
I think she kind of answered it for all of us. But I do completely agree. We should expect our government to put the health and the needs of our citizens, of our communities first. And so I'm hopeful that through more understanding and knowledge, because I think oftentimes the knowledge is the part that slips. I don't think they fully know or understand. And so I think the more that we can ensure that our politicians are aware of truly the impact that it is having on young people as well as adults. And I think if we can ensure them, I think if they understand, and I think that's the hardest part, is to get them to truly listen. And so that's where I think youth have such a strong voice, because it sometimes can go against deaf ears when it's other adults, but I think when youth come together and they speak towards it, I think that the impact can be much greater.
I would totally agree with you. But I would also say that it is everyone in the community's job. You heard the presentation. You were educated. You have knowledge now. So I think it's every community members to protect our youth and our young adults. So, I would kind of challenge you to defend your own community, to get involved, and to make sure that your community leaders are educated so they can help push and make the right decision.
I think we should expect the FDA to enforce the law, to move forward on that thing. But we should not be surprised if they are thwarted in their effort, because we know a lot of things. I taught statistics, and the thing about in policy, and we have, in many cases, we have information that is clear about the policy implications. We know what makes the most sense in terms of public policy, but that does not mean that it will happen. That if we neglect the political component, we cannot expect the FDA to do what we expect them to do without the support of politicians. And to do that, we have to do our part on that front. So expect the FDA, yes, we should, but count on it? No, we can't count on it without doing our part, and that involves the political side.
We just saw the 2022 point of sale data on the density that showed 25% of 538 tobacco retailers in Lake County and 18% of 126 tobacco retailers in Porter County are within 1,000 feet of a school. We have the research showing that youth smoking prevalence is higher among students in areas with increased tobacco retailer density. In addition, students that are frequently exposed to retail tobacco and advertising have a greater percentage of vaping products being safe. Panel, how can we get more community leaders to address the issue of tobacco retailers and vape shops being so close to schools?
When we start to normalize substances and we start to normalize tobacco use, we start to normalize vaping, we create the environment for our students and our young people to see this on a daily basis, then they're just going to fall in line with that. And so when we're having these shops nearby where our students are walking to and from school, and this is what they're passing, this is what they're going to start to learn as what is expected or is okay within their communities. And so here, I think this is one of those very much on the local level, that, businesses and organizations oftentimes have to petition to be able to start their companies, their zoning rules within each community. And if we can better educate like the zoning departments, and we can better educate our town councils, our city council members, then from a small perspective within community by community, we can start to bring about these changes. And when we're looking at the larger picture of the retail, I don't think we're going to get movement from the state level. I'm confident we're not going to get any movement from the federal government. So I think if you want a change around kind of the zoning and you want to ensure that our students can go to and from their school and they can be a few blocks away from their school and not have all of these tobacco imageries and messages in front of them, we're going to have to get our local council members and our local zoning departments to be aware of that.
Okay, I would like to use the voice mission that our young people follow. It's really going to take for you to engage in your community, to educate your leaders, and to empower them to make the decisions. And that's what our young people. So I challenge you to allow your young people to be a piece of that puzzle, to share their voice. When you're going to a city council meeting, make sure that the power dynamic is equal to, it's your role as an adult to allow them to share their voice. They are very powerful in their communities, but it is going to take your community to engage with those. You have to get out of your comfort zone. You have to be able to speak out. Have the information that you've gathered from this presentation to educate, and then go back and empower them to make decisions in their own community.
I agree with everything that's been said so far, but I also want to add the dynamic of pressure. So what they're saying basically is that you have to educate your local community, educate your local leaders about it, but you also have to make sure that you don't let up with that. So it has to be a constant message. It can be a constant message from a variety of people, but it has to always be there. So if it's not on their agenda by their choice, try to see if it can be on their agenda. There are probably a lot of different tactics about how people always get their message out, but those things that are won't land you in jail, but still, kind of keeps pressure on those that could make a difference. Keep it in front of them. I think that's basically it. You got to keep it in front of them and let them know that this is something that, is important and it makes a difference. Because, particularly when you're talking about those influences on youth, it's a difficult time as it is, just transitioning and understanding who you are, and then you've got so many different things that you can choose from, so why put that there? So again, it's just educating and pressure.
Alrighty, I actually have a further question for you if you want to pass her the mic. What do you feel like would be a good example to keep the pressure there for them?
Well, showing up at the council meetings and any places where decision makers are. But again, doing a lot of community education and showing people why this issue is important. A lot of times people focus on those things that are important to them primarily, number one. But if you if you can interrupt that, then they will listen to you as well, because it might be, oh God, I didn't know that. And then when you really think about it, well, that shouldn't be there like that. And you can begin to kind of snowball your support and the advocacy to force that change.
That was a great answer. Thank you.
Anybody else want to add to that?
Many of our peers begin working with positions in the hospitality industry and possibly continue for many years. According to research by Dr. Glanz at the University of California, the tobacco industry has manipulated the hospitality industry by spreading a myth about loss of profit when smoke-free air laws are initiated. Research shows that there really is no loss of loss of profit, and in many cases, there's actually an increase in the number of patrons and profits when businesses are smoke-free. As a community leader and someone who is concerned about the health of others, panelists, what do you think should be valued more, the life of the workers or the profits of the tobacco industry?
Well, that's an easy, that's not a tough one. That's not a tough one for me. It wouldn't be a tough one for our voice youth. And you just need to flip the script, when you're going into those smoking establishments, what is the percentage? How many people are you really protecting versus, given the right? So I think you just need to flip the message and just say the best way to increase health overall is to have smoke-free establishments.
The idea, I think one thing that might be particularly effective is the idea of we value freedom and that sort of thing. But I think the argument that has been most persuasive to me is that the workers who are in those establishments, they do not choose. We know what secondary smoke does. They don't choose to do that. So the appeal to freedom is one, well, they deserve to be free from smoke. So even though you would defend someone's right, someone's freedom to do these sorts of things, you should not impose that on others. And I think that is a very powerful argument that we need to consider more often than we do, I think.
Well, and just to follow up, we're not taking away their right to smoke. You can continue to smoke. We're just asking you to go outside to protect those within indoor communities.
Oftentimes, the profit is of primary concern. It's going to be the primary concern of management for the establishment. It's going to be, if there are investors or a board, they're looking for a profit. And if they think any change or movement that they're going to make is going to potentially reduce their profit, they're going to steer away from that. But I think it's really important for those who are constantly thinking about, okay, we need to continue to make money and make more money, to start thinking about what is the collective impact that our country, our community is going to have because of the negative health impacts that it's having on these individuals. Because we know, individuals who are exposed to secondhand smoke have potential of greater health complications as they continue through life. And the longer you're exposed, we know that the greater those risks are. And so nowadays, healthcare is very expensive. And so who is going to be paying for that health care in one way or another is going to be, yet again, every individual. And so I think sometimes you need to identify with some establishments what is their, what is that thing that is important to them. And sometimes it is the money. And so then it's taking that conversation and talk about the money. Let's look at what your profit is, but then also let's look at what the expense you're bringing onto your community because of the negative health impacts, and then because of the healthcare costs that it's going to bring in the future.
Wow. I don't have a lot to add to that. I think that we all know that it should be people first, okay? We don't act that way, but we know it should be that way. Now, the flip side of that is that you have some communities that maybe have marginalized disinvestment, that maybe see that maybe that's not a strong argument for them, although we know it's the right thing. So again, that's when I first said that it's not easy, because we can see what's right, but it's not easy. Any business, the bottom line is what they primarily care about. And they'll do a lot of different things to see if you can, maybe try to meet someplace in the middle, and that is not really what you're looking for. But it still is worth the effort. And I think one thing too that is good is, when you can teach by example and you can show where, the profit margin is not going to be that altered, or there could be some other benefits that are not necessarily monetary that could, add to goodwill or things like that. But not easy.
Commercial tobacco use and the constant surge of new products is the leading cause of health disparities and social injustice for our nation. State and local communities, specifically right here, Lake and Porter counties, Indiana ranks 41st in the nation's overall health. The recent Surgeon General's report on smoking health stated that 5.6 million children alive today will ultimately die early of smoking if we don't try to prevent this. What is your advice to young people here today to get started on fixing the inequities in our community and preventing 5.6 million children today becoming addicted to smoking and dying?
Well, I think we get back to what we've been consistently saying about education. First off, educating the community, educating your local leaders, having a presence in front of those policymakers. I was working with a federal program some years ago, and one of the things that we made sure that we did was to go to the Hill and, go talk to our senators, our congresspeople, and present our case to them in terms of, my area was infant mortality and the causes, which is why I'm interested in that, because we do see poor birth outcomes. So it's a matter of staying vigilant in terms of getting the word out about the poor outcomes, the bad effects, and keeping the community educated and the leaders educated.
It's challenging to stay up with the tobacco industry because they're constantly looking for that new product, because we know that the political system is a very slow process. And so they continue to work to stay in front of it. And you can see that by the changing of products, the changing of chemical combinations, the ways in which they can modify just enough so they can be in compliance with the law. And so it's very challenging for, I think, lawmakers to be able to keep up with the constant changes. And so I think one of and a preventative standpoint of it would be to really continue and to help our politicians to stay on that forefront when it comes to tobacco. That while we want to take every win as that win and every opportunity to be able to protect more people, but we need to also know and understand that that's not the last time that we're going to have to address this, because we know the tobacco industry is going to roll out with another product or something just different enough that they can circumvent or fall into a loophole. And so I feel that this is a battle that our society, our country has been undertaking for decades, for centuries. It's ongoing and it's going to continue. And so I think that we need to know that every win that we get is a great opportunity to protect more people, but we need to then be looking at the next one, because the tobacco industry is going to continue to be looking at that greater profit. And so I think that we need to keep that momentum going even when we have our wins along the way.
Yeah, I would agree with you totally with working with our legislators and really educating them that we continue to need this funding, but not only for prevention. I would build upon that to educate anyone who is in contact with a youth and young adult about that cessation piece. You heard this morning about the power of addiction, and you heard from Lauren that it's not just one group that, vapes. So really driving home that messaging that, it's not a bad choice. It's an addiction. And these young people need our support. And to get that support, we need the continued funding. So I would just build upon that besides just the prevention piece.
Persistence, Risa mentioned, Eric followed up on it. Persistence, persistence, persistence. That's what it takes. You go to a hearing, you get to know a legislator. You go to another hearing, you see the same legislator. They begin to trust you. They begin to listen to you. They begin to hear the research, which is very clear. They know that someone cares about this issue. You go back again, you go back again, you go back again. You are their go-to person on these issues at some point. But it doesn't happen unless you're persistent. You stay there, you stay after it year after year after year. I would say with infant mortality, and Risa worked on infant mortality, it was a difficult and remains a difficult problem, but progress has been made because of persistence by public health specialists like Risa and others in the field. Be persistent, be persistent, be persistent.
This question's directed to Ms. Stacy London. To close out our discussion, what is our call to action?
Wow. There was so much good information shared with you all today. And you know, I kind of put this out to you before. You know, it is your responsibility to defend your community. And you are experts in your community. So I like symbolism. I like imaging. I would say that you're each a different the vendor, you know, in your community. You have your own specialty, and I would challenge you to look to see how tobacco control, tobacco prevention, you know, education with cessation, how can that fit into your role that you do? How can you partner with these funded communities to better your own community? And so that's how I would just tie it all in.
Questions? Do we have time for questions? Okay. And then does anyone have any questions?
I do, but I'm loud.
Okay, good.
So you keep saying educate, educate, educate. So my question to you is there too young to start educating young people on these issues about talking to the people in their community about the actual information that we shared today? Is there too young, or can we just start educating all people at all ages?
I'll just talk from a personal standpoint. You know, my daughter is 6. She's just started kindergarten this year, and we've talked about this for a few years now. We talk about what we see in our community, and we talk about it in an age-appropriate way. And one of the things that I'm very mindful of is I don't want to put the stigma on it as though this is a bad person. Because somebody who uses tobacco products, they're not a bad person. And so I think we need to be very careful. I think sometimes the ideas of prevention, or sometimes we like to label individuals within, you know, who suffer from an addiction. And because that's what we know that it is, that the addictiveness of nicotine. And so we've talked with her for a number of years about what it means to have a healthy body. And we talk about food that we ingest. So we don't leave it just in one area. So we don't only talk about tobacco, we also talk about food. You know, we also talk about, you know, what is daddy juice versus what is kids juice. But then we talk about those things to a length and an understanding of making those good choices. What do you want out of your body? Because what you want out of your body is going to impact what you choose to put into it. And that's our conversation around the use of nicotine is, you know, do you know what that is that's coming into your body? What does it feel like when you're, you know, when daddy's burning dinner and you take in a big breath of it? You know, that doesn't feel good, that doesn't smell good, that doesn't taste good. And then we talk about what is it like when we're up at the dunes and we can take a good deep breath. What does that smell like? What does that taste like? What does that feel like? And so we can have these conversations even with little kids to understand. But the big thing that I really stress with her, because she just did it a couple days ago, that person's smoking, that's bad. And I was like, well, that's not a good choice. And I hope that that person can get the help that they need so they know that they don't have to do this. And so it's how we have those conversations and continue to have those conversations. If we can normalize these conversations, just as much as the thought of using nicotine products has been normalized in our communities, then I think we can get young people to see that it doesn't have to be just that way. But when we don't have these conversations with them, and then they start seeing it in TV shows and movies, and it becomes a more normalized part of their community, of their reality as they continue to age, then we have done them a disservice.
And I would just say utilize the resources that are out there. You know, the CDC know the facts. You know, they have specific ways to talk to your youth. So just utilize credible facts to educate. And I don't know if you're talking about formal education, but I would agree, you know, start the conversation at a young age.
You know, I don't really, I think both of those responses were very good, but I was sitting here thinking, if we ask again, if there are any other questions, I had one. And it kind of gets back to what you were saying about at what age, because I would like to ask the youth, at what age did you start learning about this? Your activity, your advocacy started in high school, I'm thinking, right?
It started my 8th grade year.
8th grade. Okay. Would you see any value or benefit if it was in elementary school, or was it? Was there some version of just a healthy body and what you put into your body? Did you get that, or did it kind of all land in middle school?
It all kind of landed in middle school. I feel like when I was in elementary school, vaping was definitely not as big as an issue as it is today. But I feel like nowadays it's such a big issue that it should definitely start in elementary school. I mean, even just as far as kindergarten, I mean, they're 5 years old, just educating them what these products are, you know, they're not good, and just educating on what they are.
Yeah. Now, and I don't want to start a conversation about, with parents, what they want. I'm just asking you, having gone through elementary school up into high school, your exposure to public health and healthcare in general, because I think that we have the responsibility of learning as well to find out, just how are we doing it right? What could we do better? How can we better? I love what you were saying, age-appropriate discussions, and the notion of just being healthy, because, in terms of what I do, I want women to have a healthy baby, but I don't want you to think about that when you get pregnant. I want you to be a healthy woman throughout your life cycle. So just wanted to kind of throw that out and kind of get a feel from young people if we're doing it right. So.
Any more questions?
Thank you. It's actually not a question, but I wanted to say it anyway. I don't know if this opinion counts or not, because I'm not like a teen, but I'm 23.
Every opinion counts.
Okay, I meant like age range, but I have two things to comment on with that, because it's something I've just been thinking about with the whole, when do we start teaching the youth things like that? Because for me, I think I started learning that in middle school, around 6th grade, but it was very jumbled and combined information, so I think there's definitely a way to deliver that information. I'm thinking about it now because I teach middle school now with wellness and mental health, because I major in psychology, so that's just something that I've been, tracking with. And one of the things that I heard yesterday come from a student, I'm not gonna say what she said, it was offensive, it was racist, but the reason why I bring that up is because she repeated it back to someone else, and she's 6. She did not understand what she said, honestly. She didn't understand the implications, because she still played with said child who she said the racist remark to, and the child played back with her because he didn't understand either. And all the teachers were very taken back by that. And we say, well, she's learning something at home, right? She heard it from somewhere. And, we told the mom, and she's like, where did you hear that from? And she's shocked by it. But we're all just internally thinking, well, she probably heard it at home, And so it's been in my head all day, honestly. And I think from my personal perspective, that I honestly would honestly start thinking about talking about important topics like that with kids. I think, honestly, first grade. Because even if they don't fully register all the information, because obviously you have to deliver it a certain way so they understand, as you said, right? There's a certain way to deliver that message. But I honestly think it's super important to start in first grade because they're already internalizing different behaviors at home, So even if you just say, no, tobacco is bad, no, smoking is bad, at least they'll hear that at school, or in the educational program that they're in versus what they're hearing at home. So that's my 2 cents.
I concur with her about the age. I'm thinking 5 years old because just like you said, the younger, they're like sponges. They suck this stuff in, and as they grow, they learn, and when they get to middle school, oh yeah, I remember that. I mean, maybe a cartoon or something like that, age appropriate interventions or whatever. But 5-year-olds, I think, would be cool, to start it.
I love what you're saying, because what you're talking about is just giving kids an opportunity and a safe space to have a conversation. And if we can let them know and understand that it's okay to have this conversation when they're 5 and 6 years old, then when they get into that middle school and those challenges become a little bit bigger, hopefully you've already had that foundation, that you've already established that relationship where they can still come and talk to you about it. I think when we wait until they get to that correct age, which again, what is it? There's really no correct age because every child's different. We know the way that typical adolescent development is going to look very different from one young person to the next young person. But if we can, as the adults, as not just the parents, and first off, I believe parents and caregivers should really take a key step in this. But then looking at the other roles of adults that support young people in our communities, our coaches, our educators, our camp counselors, somebody, within your faith community. There's a lot of different adults who can build those relationships, those healthy relationships with our young people. And if we can empower them to know and get them to understand that they can have these open conversations from a young age, hopefully it's going to give those greater opportunities as they get older and those challenges become bigger, that they know that they can have a conversation without fear of punishment or repercussion. Because that's what I have seen is as they get older, they're afraid of what will happen if they bring up a topic. And if we can just normalize these conversations from a young age, then those topics aren't taboo or scary to talk about as they get older. That's just me.
Okay. I want to say thank you to our panel. As you have done for a while, and not aging you at all, but you continue to plant seeds in the lives of our youth, and we thank you for that. We appreciate you spending the time with them today. Now, to our youth, of course, my opinion is biased. You guys rock. And I want you all to know, as we say all the time, we got your back. So we're here, we stand with you, and we will continue to empower you in any way that we can. There is a message, and a lot of our legislators wanted to be here with you because they love talking to youth, but they were unable to be here. So we told them, don't worry, we'll call you up, and we'll get back on your schedules. So just, be aware of that. But my opinion is very biased. We love these kids, and we do everything that we can to train them, to teach them, and to be with them, and to support them. And we just want our community to stand with us as we do this. And we want to thank you. Just thank you. And I'm going to turn it over to you, Donna, to give our instructions for our lunch.
All right. What a great conversation, right? We just need to keep it going and keep it going. It's lunchtime. Yay. We made it. We're halfway through, right? So we can stand up, walk around. We have box lunches available for all of our registered participants and our speakers. It is in the Victory Bell Room, which is right across the hall where we had the breakfast stuff set up, which is still out. So if you want another scone or some of that wonderful bread, it's in there. For if you are a VU student watching with us today, either here locally or in one of our other rooms, you just use your student registration and go do lunch as normal. So we will be back here at 12:15 for our lunch keynote, which is Dr. Kessler and Dr. Raymond. So fluid exchange for yourselves, get comfortable, grab your lunch, bring it back in, and we'll start back up in about 15 or 20 minutes. Thank you.
Trying to figure out if it'd be easier to try and get the Google Drive up or this.
I'll email it to you. Well.
Okay. What did you save it under?
It's just called build a PowerPoint slide. I think it says TEPC. Yep.
There it is. Done.
So
Whoompa.
it's that slide, then the next slide has the student names on it.
And
The
I
next slide
think
is
we
the-
can just,
Yep.
yeah.
That's all I did. I thought I'd organize it.
Yeah.
We can just go page up.
I'm just. Here we are.
Okay, so to make it go down, we hit enter. Okay. And then page up.
And that's still live. So.
That's all right.
And I know Carrie's already stressed. I was laughing. I'm like, you get to be Dr. Kessler and I'm just Lynette.
Oh. But you are associate professor and assistant dean. I put up there.
You should have professor and conductor.
There wasn't that much space. I didn't want to have a third line.
The median score on the pediatric exam last night was 67.
Oh no.
So,
And that was probably the exam from the previous year. It wasn't one she created.
see, I don't know because I thought Christina was starting her at 5:15 last night. So she and I talked. And I said, Ingrid had called me about exams, so I'm trying to, she had the old exams, but she wanted to create her own questions. She also wanted to look at stuff. She changed the math test. I talked to Christina about that. Christina, I don't think any of us were deliberate enough in our planning for who was going to help her do it. Probably not. Because I don't know that anybody told her that she needed to have all this hours. I don't know. So I have
Quite honestly,
anywhere.
we probably were thinking that Christina was doing it because she's the one who made the contact.
And I have
passed along
anywhere from
information.
1 to 3 classes are canceled. I have so Ingrid called Christina this morning and said, "Should I curve the test?" I mean, the highest score is an 84.
She asked you.
And Christina's like, let me look at it. She called me, and I said, well, you know, peer reviewing Christina, then I'll look. I said, I'm not a peds person, so I'm not gonna be able to, you know. That?
It's not much in it, you may want to.
No, there wasn't, it was just in case I choked.
Oh, okay.
I don't think it'd dry throat.
But I looked through it, and I wrote a bunch of stuff down, gave it to Christina. There's like 6 questions on dehydration and diarrhea that 30%. There are questions that there's like 20% on each one. So it's kind of obvious that it wasn't covered. And then there's a lot of select all that applies, and this is
You got to get them all to get the question.
well, and NCLEX is now doing partial credit. So, and I'm sure no one told Ingrid. So I wrote all those down for Christina, and I said, when you talk to Ingrid, I'm more than happy to fix and work and alter and do this and that. But it's topics, because there's some, you know, there's like 90s that, like Asha is in the 70s, and she's not that student. So I sent an email to Ingrid this morning and just said, I would like to meet with you either in person, on the phone, or on Zoom to discuss some concerns that are being brought to me by the students, which is why I want to verify with you, said regarding some canceled classes or office hours. And she accepted the job this morning. So
we got to work with it.
yeah, and I think we can. I think she's willing to.
I'm wondering if she has too much confidence in what she got. She was just trying to be independent.
Right. And I think there's also a bit of overwhelming when you tell a student how kind it's you because I taught them. See, then I have Noah in the back of my head because I still had a part-time job my very first time that Noah was orienting all of us individuals. This meeting was to my job, and she's like, I thought this was your job. And I'm like, oh my God. Yeah, Karen's got it. She's got it. Yeah. Good. For lunch, yeah.
lot of thought. Seriously. So. No, I haven't given it a whole lot of thought yet. I know there's a lot of requests for simulation activities and stuff. I know that from what I've seen at other universities, we really need to carefully consider that. And I'm hoping Gail has seen a lot of other places to give some sense of that. Are you in the order of presenters? I love Carrie wants us to talk. Hi, everybody. I think it's 12:15, so we're going to go ahead and get started. And we know you're eating while we're presenting. That's okay.
And we promise to talk loud enough it overcomes the chips.
That's right.
That's always my problem. I can't hear over the chipping. Thank you for coming. I'll introduce very quickly. This is Dr. Terry Kessler. I'm Dr. Lynette Raymond. We have an undergraduate nursing research team. They can introduce themselves as they come up. We facilitate, and Professor Kessler has facilitated for a number of years, this undergraduate research team where we work together to find a topic. Usually for a couple of years, the students come up with an idea of what they would like to research, what they would like to find out. 2 years ago, they chose vaping, so we're excited to present to you our research from the last 2 years regarding undergraduate nursing students as change agents. And the first part of the project, first year, focused on perceptions across campus of vaping. Second part of the project was what were the perceptions after an intervention had taken place, which they came up with the interventions as well. So I'm going to turn it over to our team and start with Asha.
Oh, I'm going to go first.
Oh, you're going to go first.
I'm actually going to step in and say a little bit more. I don't know if you've noticed, but we're all color coordinated. We did that on purpose, so we're all. Oh, I think Carrie may want to say a few more words before I continue. Okay. That's okay.
We just start on, we were making sure everybody was fed, so that's always good. Yeah.
Everybody's got their lunch, so please continue. Again, I'm Carrie Higgins and serve as the coordinator here for the Tobacco Coalition, but I am really honored to work here with the College of Nursing and these great colleagues. I have the privilege of working with these speakers as a colleague of theirs in the Department of the College of Nursing and Health Professions. I'm very honored. They do great work, and they perform outstanding research and teaching, but yet they encourage students to think and experience far beyond book work, and that's very commendable. They have focused their research on collegiate vaping behaviors, and we know that many students start vaping in high school, middle school, sometimes even grade school, like we talked about. I know a principal told me he had 6 fourth graders that he caught vaping in the bathroom the other day. So it's no wonder that college-age students would continue to be plagued with nicotine addiction and potentially and ultimately addiction then to other substances. We know now that even nicotine addiction can lead to increased levels of mental illness and anxiety, which definitely affects academic performance and relationships in college among the students and even secondary school students. So the research they will discuss today was conducted collaboratively with undergraduate students, 5 of whom join us today. Drs. Kessler and Raymond, along with these students, analyzed the use of electronic vaping devices among college students after the Anti-Vaping Ongoing Information Dissemination or AVOID program. Dr. Teresa Kessler teaches courses in both the undergraduate and graduate programs in nursing as well as public health. She is certified as an adult health clinical nurse specialist through the American Nurses Credentialing Center and is a certified nurse educator through the National League for Nursing. Dr. Kessler has conducted a variety of research initiatives in undergraduate student populations, including vaping, smoking, abstinence, and education, alcohol and binge drinking behaviors, and attitudes and beliefs about marijuana. She's presented her work at national and international conferences. With the most recent, her and Lynette Raymond have just gotten back in the last couple months from Scotland, where they presented this research, and she's published in a variety of journals. Dr. Raymond is an assistant dean of undergraduate nursing and associate professor of nursing, teaching in both the undergraduate and graduate programs, and her 34 years of clinical experience has been in the critical care environment, including medical, surgical, cardiovascular surgery, neurological intensive care, and multiple trauma. Prior to teaching, she was a cardiovascular clinical nurse specialist and is certified in critical care nursing. She's a member of Sigma Theta Tau International Honor Society, Zeta Epsilon Chapter, American Association of Critical Care Nurses, and the National Association of Clinical Nurse Specialists. She's also a certified BLS and ACLS instructor. So let's welcome Dr. Terry Kessler and Dr. Lynette Raymond.
Thank you, Carrie. Okay, we'll go back to where, that's all right. So you kind of have a sense, a little bit of our background, and I just wanted to say a little bit more about that. So I put up this title here, Undergraduate Nursing Students as Change Agents. And I think that's one of the messages that I want you to take away, is that over the years in working with undergraduate students, they really do make a difference on campus. And because their peers, they have the ideas of how best to interact with their peers and how to make a difference, and they really do make change. And you'll see through the results of our research that they did make a difference in terms of vaping practices. The other thing that I wanted to add, and Carrie mentioned a little bit about it, that we've done some of this work for many years here on campus. And originally we started with smoking cessation, and we did a project with that for multiple years, and we got the basketball team involved, and we got different offices involved on campus, and we really did make a little bit of a difference. Not as much as we have in vaping, but we did make a difference in smoking at that time. And then time progresses, and now there's less smoking on campus, but there's more vaping on campus that we've discovered. We've looked at other things, as Carrie mentioned. We've taken a look at substance use. We took a look at marijuana use in particular very strongly, and that was very timely, especially as we know what's happening in different states in terms of legalization of marijuana use, and we wanted to put education across to students. And then we also took a look at binge drinking and drinking behaviors on campus. Again, we know our students on campus and what kinds of activities they're engaged in, and we really made a difference there in getting messages out about binge drinking. So when we switched to vaping, it was really because of what the students had seen themselves, not only being students in high school and here on the campus and knowing what was happening, but also seeing at that time that there were quite a few stories out in the news media about college students being hospitalized because of vaping and the impacts in that. So that really fired them up in terms of wanting to take a look at vaping. And of course, then we have COVID in the middle there, which kind of caused a little bit of constraint in terms of how it's carrying out our research, but I think it really did impact them. And so then we decided to bring that to campus, which really fit well with TEPC and the messaging and everything that we're trying to get going on in that regard here in the county. So these are the students, and I wanted to mention just a little bit about the process, that it is really a very much a student-faculty collaborative model in the fact that the students come up with the ideas, they direct them, they're actively engaged out there and carrying out the activities to make the interventions come to life. And so we're going to be sharing, as Professor Raymond mentioned, our pre-survey to get an idea of what was happening on campus, and then we had our interventions, and then we did a post-survey to see the changes and if we made a difference in changing behaviors on campus. And you'll see that we really did do that. So the students are going to share this information. We thought it'd be better to hear it from them rather than hear it from us, because they're the ones that are doing the work. So we're glad that they've agreed to be here with us. Speaking public is probably not top on their list of things that they want to do, but I do want to mention that they have presented elsewhere. For instance, here on campus, they presented Source. They've also presented, Asha and Estelle presented at the Midwest Nursing Research Society last spring. That information they've also presented at Sigma Theta Tau, the Honor Society for Nursing down in Indianapolis, which is a national, international conference. So not only do we share our work here locally, but we take our work elsewhere. And as you heard, Professor Raymond and I got to go to Scotland and share our work. So
thanks, guys.
Yes. So we do want to disseminate what we found and realize the fact that we can make a difference in terms of vaping behaviors. So I'm going to stop now and turn it over to Asha, who's going to lead us out. She'll introduce everybody, and then each student will introduce themselves as well. So welcome, Asha.
Hi, everyone. Welcome to our poster presentation entitled Vaping Prevalence on a College Campus Using a Mixed Methods Design. I'm Asha. I'm a senior.
Just go to the next slide.
Sorry. I'm Asha. I'm a senior, and my peers who are also authors on this project include Estelle and Mariana, who are seniors, and Nick and Isabel, who are the juniors on this team. We are pleased to share our research with you. First, I would like to talk about the significance of the problem. Students in college are especially at risk for adverse effects surrounding the usage of electronic vaping devices such as Juul, Posh, and other electronic cigarette devices, since there is minimal published research regarding the products. Studies from 2019 show that 19.6% of high school students, which is about 3.02 million, and 4.7% of middle school students, which is about 550,000, reported current electronic cigarette use. Many users do not understand the extent of potential harm they are exposed to through vaping usage, given that many perceive it as less risky because the product's original marketing as a cessation device. 3.6 million U.S. youth still currently use electronic cigarettes in 2020, and among current users, more than 8 in 10 reported using flavored electronic cigarettes. The popularity of flavored electronic vaping devices is a common theme that was discovered during our research, and what interests is that some states have introduced the idea of banning flavored electronic cigarettes. The main objective of the study was to assess the attitudes and beliefs related to the use of electronic vaping devices held by college students at a private university, better understand the use despite adverse health effects, and identify interventions aimed at preventing vaping and promoting cessation. Next, we identified a theoretical framework. In our research, we decided to develop our plan based on the social learning theory, which states that people learn new behaviors through observing others, and the trans-theoretical model, which states the stages of changing to a healthier behavior. For example, in pre-contemplation, a person has no desire to change their behaviors. Next, in contemplation, the individual begins to think that they maybe need to change their behaviors, which is where education can make a difference. The stages continue through planning to change and quit, and eventually no longer engaging in behavior, such as vaping. This change can take months to years. The methods we used include the following. First, the group received IRB approval at a private, faith-based, and Midwestern university. We used a mixed method approach combining quantitative and qualitative techniques. Our research was conducted through a survey and focus groups. Using SurveyMonkey, we sent out a survey to 800 undergraduate students on campus through a random stratified sample, and we received 487 responses, which was a 61% response rate. For our focus groups, we conducted 3 groups with 8 to 10 students each, equaling 34 students total. Our qualitative data were collected and analyzed through the focus groups that we have structured with open-ended questions to really promote conversation and explore our peers' opinions. The data we collected through the surveys were analyzed using SPSS 25, and the content we received through the focus groups was analyzed with verbatim transcripts. Going into detail of the participants' quitting plans, of the 487 students who responded, 66% were female, 82% were white, 23% were affiliated with Greek Life, and 23% were student athletes. When asked if the participants used an electronic vaping device in the last 30 days, 17.85% responded yes. However, other data supports higher usage rates than indicated. Furthermore, 41% of those who responded yes said they vaped daily. 12% had a plan to quit in 6 months. 12% think vaping is not a problem and they are not quitting, and 10% think of quitting but have no plan. When we asked the participants reasons for vaping use, 71% of participants described that they vape because it made them feel more relaxed. That percentage is interesting because 69% of vapers acknowledge that vaping makes them less healthy, and 65% indicated that they would be disappointed if their friends vaped. Fitting the trans-theoretical model, we also asked our participants about the stages of change. 21% said that they had already quit. 12% said they were thinking of cutting back, and 14% said that they were thinking of quitting in 30 days. From our results, we identified different characteristics which helped define those who had used vaping devices before. First, we found that the number of those who vaped varied by college. The College of Arts and Sciences had the largest percentage of student vapers, followed by the College of Nursing and Health Professions. As a fellow health major, we were really disappointed in finding and expected more of our peers. Then we found that the year in school also provided differences in vaping usage. 39% of freshmen, 53% of sophomores, 61% of juniors, and 52% of seniors had used a vaping device before, meaning juniors were shown to have the highest prevalence of vaping. Next, we found that GPA demonstrated significant differences in vaping use, with greater percentage of device users having a lower GPA. Therefore, the higher the GPA, the lower the prevalence of vaping. This is not a cause and effect, but it is an interesting correlation between vaping rates and student grades. Our last characteristics that we found was that 30% of those in fraternity and sorority life used significantly more vaping devices than those not affiliated with a sorority or fraternity. From these descriptions, we saw 5 themes emerge, which were that vaping is safer than smoking, it's cool in high school, it's generationally chill, that students quit because of consequences, and the ease of accessibility.
My name is Estelle, and now we are going to cover some thematic quotes. You can see some of these quotes on the poster. Throughout our focus groups, we identified multiple themes about vaping through the use of quotes we gathered from our participants. The first thing we noticed is that vapers found vaping to be safer than smoking cigarettes or marijuana because the effects were unknown. Second, the theme that vaping became cool in high school emerged, which was supported by the concept that vaping in high school became attractive because it was illegal and not approved by parents. This brings me to the third theme we noticed, which is that vaping can be seen as generationally chill. In talking to our focus groups, it appears that our generation does not judge any interactions as good or bad, but wants to be inclusive of everyone. For example, this quote demonstrates our generation's forgiving nature. Quote, "Our generation, I think, is more forgiving when it comes to things like marijuana use, vaping, drinking, things like that, because we are awesome," end quote. This perspective of generationally chill is detrimental because no one is held accountable for the consequences of risk behaviors. Fourth, we identified that vapers decided to quit because of consequences such as headaches, mood swings, and other negative health effects. The last theme we identified included ease of accessibility, which included factors such as finances, age, and location of vaping products. Regardless of age restrictions, vapers were still able to obtain vaping devices. For example, older siblings and upperclassmen frequently purchased it for underage users. Others could identify a location where they would not be carded, so they could easily get it. Now I'm going to transition into a summation of our findings. Unfortunately, vaping is a common practice among college students, according to the data, with over 50% vaping at some point in their life. Some college students may use vaping as a coping mechanism in order to deal with stress and feel more relaxed. There was a higher incidence of vaping in fraternity and sorority life, and there was a correlation between a lower GPA and vaping use that Asha had gone over previously. Most students reported exposure in high school, and lastly, students believed that their peers were less judgmental, risky behaviors such as vaping. All of these factors can lead to riskier behaviors and potential for life-term health problems. Based on the information we gathered for our research, we have identified interventions to prevent vaping usage and promote cessation. Some of these interventions include starting at the policy level, where we had recently sent electronic correspondence to the Public Policy Committee of the Indiana House of Representatives. We spoke out in favor of banning flavors in electronic vaping devices. Our next intervention was to look at the university policy on vaping and potentially work with the Student Health Center to provide education to further promote cessation and prevention. This brings me to our last topic, which includes our recommendations as to how to tackle the drastic spike in vaping among college students. Since the prevalence of vaping has increased, nurses and healthcare professionals should become equipped to help inform vapers about the negative effects. However, more research and detailed analysis are necessary to understand the long-term effects of vaping. Now more than ever, a change needs to occur, and it all starts with informing people on the potential consequences of vaping usage. Before we go on to the next phase of our study, are there any questions regarding our first phase of the study? Yes. Did you have a question?
Yeah. So what led you to wanting to be involved in this study?
We had gotten an email. We were recommended by our nursing facility members our sophomore year, going into the spring semester of our sophomore year, and we had met with Drs. Kessler and Raymond, and they kind of explained the process and their work done through the vaping idea, and we just wanted to be on board and help promote healthy behaviors and be a part of change for the campus community, such as since the vaping has become so popular when we were more in high school, to see it kind of explode as we entered college. Yes.
So one of the statistics that she shared was that among the nursing students, among those that have the education, the knowledge, right, the exposure, that it was actually the second highest, I
Yes.
think, behind fraternities and sororities, of people vaping.
Yeah.
Was that surprising? I know you said you were disappointed in my fellow people, but how surprising is that? And did you figure out why? Like, are you more, or maybe a question for you, are you going to delve into why is it that this particular community that is nursing program that's supposed to have this education, one of the highest ones on campus that is doing it?
Yes, and I can speak louder. I think you'll see on the next set that it continues. So
Okay.
that's a great question that you're asking. But I think these guys have ideas as to why it's happening in the nursing and their colleagues.
It is stressful. Yeah, it really is stressful.
So the education, the knowledge that you're getting of what it does to your body
Yeah.
is not enough to combat the stress.
Yeah.
So is it really the education, or is it the age group that, or coping, right, that type of coping mechanism, or being on a college campus, right, that increases your risk, and not necessarily whether you're in a fraternity, sorority, or you're a nursing student? I don't know, that could be something that you're also going to answer later. Correct.
Yeah.
Yeah, and we don't have a direct answer to that.
Okay.
Exactly. We did ask some reasons why, and coping was definitely one of the top ones we addressed, yes.
Oh, sorry.
I don't think that's a new thing. I know my husband had worked in, he's not in the healthcare now, but he worked in healthcare settings himself through school and law school. And he was astonished when he was younger, because he started when he was 16, at the high number of, at the time you could smoke at hospitals, but outside, at the high number of professionals that would go outside and smoke. And so that stress level must have a lot to do with it, because there were a high number of respiratory personnel, cardiac personnel, oncology, all of those areas that know better on a professional level were all outside, and they were the main culprits. And he said he would go outside and say, "Hey doc, didn't you just do heart surgery on somebody and you're out here puffing?" And they just laugh and joke it off. And he said he used to comment to me on that he worked at multiple hospitals throughout Northwest Indiana at different times, and it was the same behavior. And he said it was always the health professionals that were the worst. So it didn't surprise me when my students, I worked with 14 students last semester, and they went out and did Catch My Breath, which is a program that we do for school
the program to our youth in the community and had fessed up to say, wow, I learned some things and realized my shortness of breath and my physical limitations and my mental coping incapabilities were being affected, and I didn't even know it, and I should know better. So we had a couple actually quit vaping after doing our program. So I think it's not a new thing that's happened.
And the other thing is it's a peer activity, it's a group activity. So we found that most students groups or stayed in groups, social settings. So they were, someone else did it, so I'm going to do it and join in, and it's part of that group process, absolutely. And what Carrie mentioned about, I would witness that as well, as colleagues would go out and smoke. They'd come back in smelling like smoking, and then go in and take care of a patient that was on respiratory distress. So it's very hard to know how to make that connection for everybody. So just education doesn't do it, but the social norm messages, to get the messages out that it's not okay, it does cause these problems. And we even had students identify that were athletes who were vaping, and they stopped vaping because it impinged on their performance. So they were to make that cognitive connection. So there are some differences. It does make it, you're right. How our brains work and what we do is pretty amazing sometimes. Yeah. Thank you. You had a really good response rate from your survey.
We did,
So
yeah.
how was that disseminated? How did you get that out to the students? Did I miss that? I'm sorry.
We spoke to someone who has a list of all of the students' email lists, so we just like randomly selected people and then just sent the survey out via email. Mhm.
Yeah, so obviously it's a topic that interests students. We've always had higher rates. Even when we did binge drinking, we were up in the 50% response rate. So I think students are interested to know what their peers are doing, and that's a way to find out. And then we disseminate the information on campus so they can hear about their peers.
And then did you also have a question?
Yes, you had mentioned that you found in your research that those who vape had lower GPAs.
Mhm.
And I was just wondering if you were doing anything longitudinally to find out if there was a connection between college dropout rate and vaping.
We did not. Yeah.
Yeah, no, we have not, but that would be, it's very hard once students leave campus to get information from them about how they leave or why they leave, but that would be a great connection.
Does anyone else have any other questions before we move on? Oh, yes.
So is the university tobacco-free campus?
Mm-hmm. Yeah. Anyone else? Oh. Yes.
Well, the other thing that we learned in this research, and the students can probably share some of this as well, is that how evasive individuals can be with vaping in terms of, what the cartridges look like. We learned how you could put it in the bottom of a straw in a soda drink or something like that, and they could be vaping that way, and no one even know they have the vape device in their hand.
Mhm.
It was eye-opening to me, for sure.
Yeah. Anyone else? No? Yeah. Right, thank you.
Hi, I'm Mariana, and now we're going to go through the next part of our research, including our intervention. After viewing the results of college students' point of views on vaping, as well as seeing a higher number of college students than expected who vape, we furthered our research on providing education and prevention on vaping. Our current research focuses on the impact of the Anti-Vaping Ongoing Information Dissemination, or AVOID, program for helping students on a college campus to stop vaping. The most recent data from the spring of 2022, the national college vaping rate was 21.1%, which has been the highest rate in the last several years. Users may not understand the harm that they are exposed to as a result of vaping because the product was originally intended for smoking cessation. Therefore, the purpose of the study was to analyze the use of electronic vaping devices by college students, as well as vaping behaviors following the implementation of the AVOID program. Our previous work showed the following themes. College students perceived vaping as not a problem, safer than smoking, and saw themselves as generationally chill, indicating their generation was more forgiving and non-judgmental of their peers. Due to these perceptions, the Anti-Vaping Ongoing Information Dissemination Program was developed based on current evidence to promote vaping abstinence. This was a descriptive survey performed with university students following IRB approval. Monkey survey was reused to distribute the questionnaire to a random stratified sample of 900 students. This survey was sent out after initiating the Avoid intervention, which involved interacting in the campus community regarding the dangers of vaping. These interventions would include providing posters to summarize our research findings, creating a YouTube video narrating our posters, summarizing our research findings as well, and spreading our message and information throughout social media as well as newspaper articles, having a table set up about our findings around campus to communicate people who walk by, providing messages on TV displays around campus, presented our findings in fraternity and sorority life meetings, and passed out information regarding vaping with stress balls at campus sporting events. A total of 464 students responded, achieving a 52% response rate. The distribution of responses was relatively equal among freshmen through seniors. 41% were from the College of Arts and Sciences, 30% were from the College of Nursing and Health Professions, 17% were from College of Engineering, 10% were from College of Business, and 2% from Christ College. 60% of the respondents were female and 37% were male. Within the students who responded, 29% were part of the fraternity and sorority life, as well as 4% were athletes. Data analysis was done through SPSS 25. Data were collected and analyzed to further understand relationships and opinions about the use of electronic vaping devices, also assessing a change in behavior on vaping.
Hello, everyone. My name is Nick. I joined the research group last year. So from our findings, we found that a third of respondents had vaped in the last 30 days, with the highest percentage in the College of Business. Again, it was followed by the College of Nursing and Health Professions, which was higher than the national average at 21.1%. And which you recall, it was from the first phase of the study as well, which we found particularly disappointing as future healthcare experts. We could further break down by colleges in that bar graph over there. Now, how did we disseminate? We, like Mariana said, we started the Avoid program. And a part of the Avoid program included messages regarding vaping across campus. They included posters, social media, tabling displays, campus TV messages, fraternity, sorority life meetings, a YouTube video, a newspaper article, and PSAs at sporting events. Here's some of the things we gave out. Heads up. Spiral. Oh. So that's part of how we scattered our message throughout the campus. The ones that were viewed the most were the posters, followed by the social media posts. In our survey, we asked the college students what their plan was to quit vaping after the VOID program was implemented. Previously, 21% said they had already quit, and an additional 14% planned to quit within a month. This survey showed that 54.11% have a plan to quit within 30 days. Even though a small percentage said the VOID interventions had little effect on them when asked if they would recommend a family member or friend quit, the percentage was 87%.
Hello, everyone. My name is Isabella. I'm a junior nursing major, and I also joined last year with Nick. So I'm going to kind of wrap things up for us and do a conclusion. So 2 years following our original assessment of vaping programs on a college campus, our findings demonstrated that the number of students who vaped in the last 30 days decreased from 18 to 15.8%. So that's good. It's a decrease, but it's still a high number. This is lower than the national college average of 21.1%, though. While the majority of students indicated the Avoid program did not have an effect on them, significantly more students have the intention to stop vaping in the next 30 days following the Avoid program. We are not sure if these students followed through with their intention, but we can infer from the data that a significant proportion of students, as Nick said, that was 54.11%, had a plan. With that being said, the Avoid program is easy to implement and it's not costly. It could be sustained year after year as a source of support and education for our peers. So our recommendations for the future, educational initiatives such as the Avoid program should continue on college campuses. Knowledge, as stated before, is the foundation to behavior change. And peer-to-peer education is a more desirable approach because it's non-threatening. In the healthcare settings, nurses and healthcare professionals should inform vapers about the negative effects to help move college students from pre-contemplation to contemplation and even to action. The Student Health Center on campus will now screen students for vaping habits. Our research has shown that education through mass media can make a difference in behavior and increase awareness. It all starts with informing people, like all of you here today, including our peers on campus, of the unspoken consequences of vaping usage. So now we want to turn it over to you if you have any questions about our research. But we do have a question for you as well. What do you all think that we could add to our strategies, or are there any methods we could implement to affect vaping rates on campus? That's a good question. I mean, I know we did the thematic quotes, so we kind of did those focus groups and spoke with them. And we did have the quotes on our previous slide, but otherwise, I'm not entirely sure.
Yeah, no, that's another great, you've got great ideas. Yeah, that would be a great thing to do, is about try and get students who have quit, first of all, to self-identify that they have quit, because we tried to do it anonymously so that we weren't putting pressure on anyone, but then to ask them if they would share, and then that would be something that we could use in our messaging. That would be great. Carrie, that'd be a great thing for your group to continue, yes.
Yeah.
You said athletes.
Mm-hmm.
You know, usually athletes want to be in top physical condition.
Yeah.
Which athletes, did you break it up per sport, or was it just athletes in general?
Yeah, it was just athletes in general. We didn't really break it down by sport, but yeah.
Yeah, and I don't know whether there would be a difference or not. If you look at
Right.
some of their individual quotes, we could self-identify a little bit based on what they said, but we weren't able to tell specifically, no.
Yeah.
What was your messaging? You said that you used video boards and posters.
Yeah.
What was the messaging that you shared?
So usually the messaging was like just a bit of a poster kind of saying about like the negative effects of vaping, and those were in like there are like TVs in the Christopher Center Library, so they would play on those just for students to see. And then there was research at like a table in our union, so as students walked past, we could speak with them just about the negative effects of vaping, like their experience on campus.
So for instance, like one of the posters said, so you think vaping is safe, think again. And so then we would have, like a picture in that. And one of the places that we would put the posters would be like in the dorms. Years before, we used to put it in the bathroom stalls. That was usually captive audience. So we tried to get the message where the students are at. And the TV monitors and all that is very helpful.
Yeah.
All of the material had the quit line on it, and then we also had other information that we passed out as well, and then knowing that they also had the resource at the Student Health Center.
Or not.
No,
okay,
you're
thank you. Just in case. So I don't know if you all said it or not, but did you all happen to say that you all provided solutions on, I wouldn't even, well, not solutions, but more so alternatives on how to relieve their stress besides vaping and just trying to different things like that, like on the poster or in the emails, or like, besides the stress ball, like the stress ball is a good idea, but I mean like not just in the exact moment of them feeling stressed, but just throughout the day of them thinking about it, or before they go to sleep. Like, what if the stress ball's not next to them immediately? Are there any things they can do to calm them, like mentally and emotionally? And anything about like meditation or talking to someone about it? Like, were there any things like that involved?
I think that's a great point. I think that would be a great point for the future to continue with our research, because that is a big thing, especially with vaping seen as first a social thing, and second also a coping mechanism. I think the point that you make is amazing, that we should also offer okay, when you're feeling stressed or anything, this is what you can do. There are 5-minute meditation sessions online we could link to, and then other sources of support too, like the counseling center. But we did have the Student Health Center as a resource, but then again, they can also only support so much. So yeah, I think that's a great recommendation for the future, so thank you.
Yeah, and that's a great point as well. I was going to add that this second phase of our work was not to do individual kind of messaging, but rather to try and do mass messaging. And when it's been quite a few years ago, so these individuals weren't part of the team when we looked at tobacco use. When we did send out surveys to find out if they were actively smoking, then we created little kits that we sent to them in the campus mail. And in there we provided then strategies for stopping smoking, gum and stress balls and instructions and the quit line. And so we kind of did a little bit of what you're talking about. And again, it was anonymous, so they didn't know who we were and we didn't know who they were, other than we had their box office here on campus. But we did send things to them to try and help them with that when we were working with that phase.
All right, any other question? Yeah.
I can just talk really loud. Are there any thoughts of taking this framework and the work that you've done up front and people Zooming can't hear? Oh, they can't hear. Okay. So are there any thoughts of taking the framework of what you have done and possibly being able to utilize it in other colleges? So maybe potentially a toolkit or some kind of framework where if we have colleges in our communities that would be interested in doing similar efforts, that we could utilize some of the things that you've already done. Even what's up on the screen is a really good example.
Yeah, those are great ideas as well. One of the things that we do is we disseminate it. So we take it to conferences, and there we run into other nurse educators who can then take it to their campus as well. And for our first work here, Professor Raymond and I did publish that. So that's available through a journal. And then we're working on getting the second phase published, where we talk about the Avoid Plan. And what's interesting is I teach a public health class, and in that class, students have to create interventions for communities. And one of the students was wanting to do an intervention for vaping. And so he actually came up with the acronym of Avoid. And so we're hoping to get it in publication, because then we have the Avoid Plan, then it's, been copyrighted. And so thanks for the idea. But yes, that's something that would be great to be able to do, yes. I assume through the conference, Carrie, you'll have this and make it available for them? Absolutely. We're going to send that out. Okay. So yes, then you'll be able to have that. Any other questions or comments? Other ideas? You guys have great ideas. We have a new team member. Well, thank you all then for participating and listening to us. We really appreciate it.
All right, we're going to switch things out. Not really take a break, just transition. It's time for breakout sessions. So while someone's coming up here to get started and set up, go ahead. Okay. While someone's coming up here to get set up, there's also going to be someone in the room around the hall. You'll see the sign right outside the door for where that breakout session is. We start promptly, hopefully, at 1:30. So pay attention to your time. And if you're in this room, or probably in the breakout, because I think they're being sent out virtually as well, if you do have questions or comments, if you could wait for a mic. Otherwise, the people who are watching online can't hear what we're talking about. And we've been Zooming for 2 years, so we know how frustrating that can be. So try to wait for a mic if you can.
nobody can help me figure out how to find it. So, but like if I'm in the, but it's weird because it's not aligned with anything else, And so what I've learned is that if anybody, because now we use that 365, so if I can just like get on the internet, I can just pull everything from my OneDrive. So, yes. Oh, sorry. Is it okay if I jump on there and pull it up? There we go. Got there.
We got married, so I thought it was different colors.
Nice. You don't see the
Girl, when it start getting later on in the evening, this brace feel like it just does not work. Mm-hmm. All the way up here. So do they want us to just start? It's 1:30. Hello. All righty. Hello, everyone. We're going to get started. Our afternoon presentation will be coming from Eric Evans and Sherry Knowles. My name is Cynthia Sampson, and I am one of 3 tobacco prevention coordinators in Lake County. Eric Evans' bio has already been said by Emily. Where is she? By Emily. So I'll let him fill in all the blanks, but I will introduce Sherry. Sherry has worked for Lake County Superior Court Juvenile Division for 34 years. She has worked as a detention officer, detention intake officer, and a court probation officer. She has worked with all of the school districts in Lake County at one time or another. Sherry, did you want to go before Eric or?
I start.
Okay. All righty.
All right. Thanks, Cynthia.
Oh, you're welcome.
Hello.
Don't forget to introduce yourself.
Oh yeah, I'm Eric Evans. Nice to meet you all. We're going to take a look at a lot of data. And we want to paint a picture of where we see youth at here in Northwest Indiana, and looking at our data here locally in comparison to the state data. And then kind of once we go through the data piece that I'm going to be presenting on, then Sherry's going to actually bring you more of a qualitative, and she's going to speak from firsthand experience of working directly with youth here locally. And when we were talking about kind of how to pull this together, we know we need to understand where our youth are at today, because if we can better understand where they're at, it allows us to better come up with plans of how we can support them, identify those gaps, identify trends, so we can hopefully connect with them in a meaningful way. So the data that we're going to be sharing today, it's all was collected, it would have been collected in the spring of 2022 through the Indiana Youth Survey, and that's instrumented by the Prevention Insights, which is out of IU Bloomington. And so one of the first things we're just going to look at is the age of onset, and we're going to be looking at the data based upon what our local youth here in Lake Porter and LaPorte County, if we're looking at the local data, or statewide data, in regards to when was the first time you used a substance. And we know that the earlier that a young person uses a substance, the greater risk they are going to be at. Greater risk of experimenting and trying additional substance or potentially leading to an addiction. And so when we're looking at statewide data around it, you see that most kids on average are first experimenting with substances around the age of 12 to 13. So we see, I'm not going to sit here and read all these numbers to you because I'm confident you all can do that yourselves. But I think that what I find to be very interesting looking at these numbers is the consistency within it, that we really don't see a lot of variation. And so when we're looking at what our kids are experimenting with, they're experimenting with a lot of substances at similar times. So it's not as though there's one substance that is starting at a much younger age and then leading to others. We're finding that youth are experimenting across the board. We also look at the perception of peer use, because we know in typical adolescent development that youth are going to pull away from their parents, and they're going to move more into wanting peer acceptance. They're going to be moving more into being influenced by their peers than they are going to be as influenced by their parents. Parents are going to have to continue to work hard on keeping that influence with their kids. And what we found is that when youth believe that their peers use substances, when youth believe that their peers find the use of a substance to be the cool thing to do, they're more likely themselves to then try a substance. While it might not be something that they specifically wanted to do, but it's that peer pressure. And it's not always peer pressure as in one kid pressuring another kid to try whatever the substance is. Sometimes it's almost an internalized peer pressure where you believe, you perceive that everyone else is doing this. And so when we're looking at, this is looking at the age 7th grade through 12th grade, and this is state data. When we're looking at the average, the rate of actual use versus what the youth said that they perceived the use rate being at. The actual use of tobacco was averaging 1.9, but the perceived use was 26. Again, alcohol, the actual use was 10.9, and the perceived use was 37. I think the biggest difference is you're going to find is with marijuana. You know, the actual use was 6.4, but youth perceive that, you know, that nearly 40% of youth are using marijuana. And we know that that is not the case, but they believe it. And this, you know, when you think of perceptions, you know, the perception is, in a sense, a person's reality. And if that's what they believe to be true, then that can be a motivator or a deterrent. And so we want to try to better educate so that way it becomes more of that deterrent and not that motivator. How easy is it to get substances? Looking at the access, where are youth turning to get alcohol, marijuana, and other substances collectively? So I pulled specifically the 10th grade data for this one, you know, and the question that the youth were asked is, during the past year, how did you get, and then it listed a bunch of different, it listed the different substances. And so what I did for all of these is I pulled the top 3 uses. And so with alcohol, the primary response was at a party. But then 5.3 of youth said that they got it from a parent and guardian. And then, you know, 4% moves down to other family members. So we know that when just simply looking at alcohol, we know the impact or it's important that we connect with families and we get families to understand why we don't need to be giving our 10th graders alcohol. Prescription drugs, and when we're looking at prescription drugs, they always are very explicit to state, you know, the intent to get high. Most youth used prescriptions that were prescribed to them, but they used them in a manner to get high and not in the manner that was intended with the prescription. That was followed by someone other than a parent, and then the final one was they purchased it. And then lastly, the one I wanted to point out was marijuana. A friend was the primary provider of marijuana to peers, as well as purchasing it, again, from somebody else or obtaining it at a party. So there are things that can put youth at greater risks. And so when we're looking at our risk factors, you know, we want to better understand and identify what within our community can, I find this weird, it's a risk factor. What can put them at greater risk? When we're thinking of the risk factors, it increases the likelihood of something happen. It doesn't mean because there's a risk factor present that it means that explicitly that young person is going to use XYZ substance. But we know that there are certain environmental factors that can lead to greater chances for it. And so when we're looking at some of these risk factors, they break it down into 4 different sections. One is community, one is going to be school. We're also going to be looking at family, and then individual and peer. And so again, this is using the statewide data. You have 6th grade, which a few of them we don't have 6th grade data on, 8th, 10th, and 12th grade. And so when we're thinking about risk factors, we look at laws and norms that are favorable towards drugs as being one of the risk factors. And we're seeing that youth perceive, again, that the environment, that the repercussions for substance use is favorable for substance use. When we're looking at school, we look at school academic failure and we look at low school commitment. And when we're talking about low school commitment, it is youth that don't feel a connection to their school, that they don't feel a part of that school community. And oftentimes, if they don't feel a part of a school community, then they're not going to have that intent of academic success. And so we want to be mindful of these risk factors. You know, when we're looking at family risk factors, family conflict and poor family management. You know, youth that have a more unstable family environment could potentially be at greater risk of using substances. You know, and we found that anywhere between about 40 to 50% of the youth that participated in this survey across our state, you know, expressed that there is, you know, family conflict that is happening in the home. And so that conflict is putting them at greater risks of potential substance use. I always find the parental attitude favorable toward drug use, as well as the parental attitudes favorable towards antisocial behaviors. And what they're really looking at here as far as that antisocial behaviors is how do the parents present it? What types of rules, regulations, framework do parents have in the home in regards to things like substance use or antisocial behaviors, which are going to include just troublesome activities. And so when youth believe, and again, a lot of this is going to be perceptions because this is how the youth see their families, they believe that, you know, you have 30% of 12th graders who think that a third of them think, my parents don't mind if I use substances. My parents are okay with it. When we're looking at the parental attitudes favorable towards the antisocial behaviors, you have nearly 50% of, that would be 8th graders, who don't fear consequences because their family they perceive their family as not having that concern on those types of behaviors. And it's also important to look at their peers. You know, we talked a little bit around peer perception, and then also looking at the individual risk factors. So early initiation into drugs, you know, was one of the things that we talked about a little bit ago about the age of onset. But then looking at the peers' attitudes, favorable attitudes towards drugs. I'm going to toggle back and forth here, even though I don't like when people do that. But I want you to look here at how youth perceive their peers with the favorable attitude towards drugs. So let's look at 10th grade is 36% and 12th grade is 37%. I'm going to flip back to parents. The parents' attitude was at 26% for 10th grade and 30% for 12th grade. They're not that different. So youth are perceiving a very similar concept from their peers as they are from their parents. That substance use, and again, this is a little bit of a broader term around substance use because there's a lot of different substances within there. But it's good for us to understand that part of the conversation that's not happening in our communities. Just simply looking at the youth's individual perceptions as far as the risk of drug use. There's not a lot of risk associated by young people when it comes to substance use. A lot of the questions are going to pertain predominantly to alcohol, marijuana, and tobacco products. And so you see 75% of 12th graders don't find risk in using of substances. And then the last one is reward for antisocial involvement. This is going to fall back more into the peer category, you know, that youth are going to be able to have the friendships, be recognized as cool, to kind of have that persona by engaging in more of that reckless or antisocial behaviors. And so, you know, between 35 to 43% of youth find that to be a positive thing within their peer group. You know, it's good to be bad kind of concept. While we know that there's these perceptions, there's these experiences that are going to put youth at greater risk, there's also protective factors that we can bring to the community. But it's important for us to understand that a protective factor does not counter a risk factor. The risk factors are still going to be there even when we bring protective factors. So one does not cancel out the other. But where we can bring these additional buffers, the better opportunities that our young people have. And so again, looking at community rewards for pro-social involvement. We do see that young people find some reward in being engaged and involved in their communities. But then when we draw down to the family opportunities for pro-social involvement, we see that number dropping quite a bit. So they feel from the community perspective that there is recognition for that more positive behavior, positive engagement, but it's not being as seen or felt at the home. And then family rewards for pro-social involvements again, not as recognized in the home in comparison to recognized in the community. Looking at a few around school opportunities for pro-social involvement, and then school reward. So about a third, of students feel as though there's opportunities available to them in their schools to be engaged in those pro-social and those positive experiences. I would suspect that there are more opportunities than that within their schools, but they might not see the benefits or understand that those opportunities are available to them. And we see about nearly 50% of students do see that kind of positive engagement in these positive activities within their school does bring about some kind of reward. And youth are finding that interaction with their peers in these positive experiences and opportunities is, again, right around that 50%. So when you're thinking of what we have as far as our protective elements within our communities, we need to look not just in one area. I oftentimes feel when we're looking at our protective factors and we're looking at our risk factors, we look at our schools. And it's almost as though our schools are the sole provider for bringing about those protective factors, and our schools are almost the one who is specifically blamed for risk factors. But in order for us to have that healthy community, in order for us to have that overall healthy environment for our young people, we need to be looking at our schools as well as our families, as well as our peers, and looking at the individuals themselves and the opportunities that they may can take advantage of themselves. So youth are asked questions pertaining to their past 30-day substance use. So the question I'm going to paraphrase is, within the past 30 days, how many times have you XYZ? So the first one is looking at cigarette use. And so the percentage of youth that reported using cigarettes in the past 30 days, this number I thought was pretty good. Especially in comparison to where it has been. I've been around started back in 2008, working actually with Voice in Lake County a few years back. And this number was probably about 3 times higher than where it is today, if not maybe a little bit more. So there's been a lot of great work that has happened, and a lot of great work specifically around cigarette use. But then we flip over now to the electronic vapor use. This was a little bit more of what, when I was started back, a handful of years ago, this was very similar in the cigarette use. And so what we have seen is this really good push and really strong understanding and education and advocacy taking place around cigarettes. But then, I don't want to say we got outsmarted, but somebody, circumvented that by creating a new product that was specifically targeted and marketed towards our young people, looking at our vapor use. So within here, kind of that, I don't know what it looks like up there, kind of that orangey color, that is going to be Northwest Indiana. So I believe we had just shy of 15,000 students within Lake Porter and LaPorte County that participated in the surveys. The blue color is going to be the state average. So we run pretty close. The 7th and 8th grade here locally, our 3 counties are lower than the state average, but then once we get into the 11th and 12th grade, we do exceed the state average in vaping product use. Looking at monthly alcohol use, within kind of that middle school age group, we are on par or greater use here locally than on the state level. And then we also see that again once we get back into 11th grade. This is another one of those areas I think it's important for us who work in the public health field to look at the data. Because prevention is an area where you don't necessarily get the opportunity to see the impact of the great work that's taking place. And sometimes it's when you are looking at the data a couple years out, a couple years out, a couple years out, is when you can start to see that there is an impact that's being made. Because it really wasn't that long ago where 12th grade was closer to about 25 to 27% alcohol use here locally. And so to see it, below 20% is actually a huge drop. And so it shows the work that is being done locally. One of the areas that they also look at is binge drinking. With binge drinking, they talk, it's specifically stated, the number of drinks had within a certain time period. And so again, we do see 8th grade being the only grade where we here locally exceed that of the state level. But they stay pretty consistent when they get into high school. Our marijuana use, on the other hand, here locally, mostly is greater than the state average. And I think that's an interesting thing because if you look here in Northwest Indiana, 2 of our counties are connected to states that have recreational marijuana use. Looking at Lake County, which is right there in Illinois, and LaPorte County with Michigan. And we also, Indiana, we're the crossroad of the nation, we really do have a lot of traveling that happens in between our communities. And, if you ever, are bored and you want to read HIDA's, drug trafficking reports, they're fascinating. And what is coming through and how our communities are on a number of paths of transporting drugs and substances across our country. There's a lot that goes through 65, 94, and 90. And so marijuana is one of these where when we have been looking at the perceptions of the risks of marijuana, we have continually seen that perception of risk of marijuana go down while we're simultaneously seeing the use of marijuana increase, which is the opposite of what we have found with tobacco, where we have been seeing the perceptions of risks of tobacco go up, where young people are understanding that cigarettes are bad. We're having more young people who believe that, and they're not smoking cigarettes to the rate that they were. So their perceptions of harm are going up, and so their use is going down. But we've been finding the opposite with marijuana because, within the past, I'd say about 10 years, there's been a lot of legislation that's been presented locally across the country. There's been a lot of conversations around marijuana and the risks around it. And so the data falls right in line with that. Prescription drug use. I thought this one was interesting because 6th grade was so high. They do have a lot of checks and balances in these surveys, where the question is asked in multiple parts of the survey, and the question is asked in a few different manners to ensure that, young people, that when they're doing the survey, that they're providing legitimate answers. But I was kind of surprised by that. But you see that the number is pretty consistent, though, from 7th grade through 12th grade, as far as misusing prescription drugs. And so we understand and we know the impacts that substance use can have on our physical health. We know the impact that substance use and addiction can then also have on our mental health. And so there are a few questions within the survey that is going to explore kind of depression and suicidal ideations in addition to. And so the question that youth are initially asked is, have you ever felt sad or hopeless for 2+ weeks in a row? And this is going to be statewide data. So this is not just Northwest Indiana. And they're pretty consistent. Right around 30, probably about 35% of youth collectively have stated feeling sad or hopeless for 2 consecutive weeks or more. This does not mean necessarily that they would be diagnosed with depressive disorder. However, we know that this is one of the areas that clinicians use when doing a diagnosis. That's like 1 in 3 kids. And you you 10th grade is the one to kind of look at because that's going to be the collective across the series of questions is always the highest, which I find interesting. But just knowing the kind of consistency. Next question was, have you considered attempting suicide? I mean, we have 18% of our 10th graders who said that they considered attempting suicide. And this is asked within the last 12 months. So they're asking in the last year, have you considered attempting suicide? So 18% for 10th grade, 17% in 8th grade, then 16% in 12th grade, and nearly 13% in 6th grade. So that's a fairly high number. And then kind of the next question, if you're looking at suicidal risks, is, have you made a plan? Have you taken that next thought beyond just simply considering suicide? And these numbers were pretty consistent as well. 10% of 6th graders said that they made a plan, a suicide plan. 13% for 8th grade, again, nearly 14% in 10th grade, and then 11% in 12th grade. So we know that our young people are experiencing things. We know that our young people have stressors, pressures that they're going through, and knowledge is power, I feel, from our perspective. For those of us here, we're here because we work with youth. We're here because we care about our communities. And so I think the more that we can understand kind of what our youth are experiencing today, the better we can continue our efforts to support them in our communities. Are there any questions kind of for me on the data piece?
Is that the newest IYS data?
Yes. Yes. So this data was collected in the spring of 22, and then it was just released, I think, earlier in September. So this was the most recent data.
So I have a question specifically regarding the data. So we're actually from Kosciuszko County, Warsaw, so about an hour east of here. And we've had issues in our county with collecting data. So we actually had no schools this year that did the IYNS because the schools are getting so much pushback from our parents about connecting social emotional learning and the questions that are asked on the survey with critical race theory. And there was a big uproar. Why are you asking my kid about suicide? Why are you asking my kid about their sexual orientation? So what can we do in our communities? Because we virtually have no data. We do have some 2020 data, and that's the latest that we have, which is fairly current. But long term, I don't see us being able to utilize that survey in our community. So we've been talking about other options to be able to collect data because we need it.
Yeah. That's unfortunate. And we're a little bit luckier over here where that mentality has tried in some of our local districts. There have been some school board meetings that have had similar kinds of pushbacks, but we have still, for the most part, most of our schools, districts are still supporting social emotional learning, are still supporting suicide prevention efforts. One of the things that I try to do when I'm sitting down with either the superintendent or whomever with the district is really just talk about knowledge is power. And if you don't know what is going on with your students, how are you going to be able to help them? How are you going to be able to support them? And the parent piece is a tricky one. Most of our districts don't take it to their school board because it is, there's already, the school board has already allows the district to implement state standard tests. And that's not, that one hasn't
Right,
worked out.
we tried all of that, and it was a big uproar in our community because Todd Rokita, the Attorney General, came and he
Yep.
did a talk and he connected critical race theory with social emotional
Yep.
learning. And a lot of high-profile Republicans in our community came out with, oh, well, they're promoting LGBTQ to our kids. They're trying to indoctrinate our kids. And it's like, no, we just need to know what's going on, because how can we help to make things better if we don't know? So basically, none of our schools will do the survey. Like I was saying, we have no data. 2020 was the last data that we collected, and we don't see an end in the sight in the future of being able to do much in our community, because there's just this huge concern with, why are you asking my kids these questions? Why do you need to know? And we need to know, but they don't understand.
Yeah.
Yes, it's like, so, yeah.
Yeah.
So, and not even so much the parents. So a lot of the people I know in the community, their kids are not even in school, they're adults. So we have these very boisterous people in the community who are saying, why are you asking our kids? And it's like, no, I have a son that's in school, you don't. And again, most of them, I would say they don't have kids in the school. So now we have no data, we have really no way to know what's going on. And we were actually in a meeting yesterday about trying to do an alternative survey. Maybe instead of going through the schools, that we do it some way through the public or through the parents to try to collect that data. But it's just been a huge struggle for us. And then people are looking at us as youth prevention as, well, what you're doing isn't right. Like, you shouldn't even be coming in and talking to that stuff with my kids. That should happen at home. You should be teaching math and reading and science, and that stuff shouldn't be in our schools. And it's like, but you know what? These kids aren't learning it at home. That's why our society is the way that it is right now, is they're not being taught how to regulate their emotions. They're not being taught how to make healthy decisions. And now they're saying you can't do it in the schools either. So what do we think is going to happen 5, 10, 15 years down the road?
The implications of that, yeah. Some of our districts where we've had a little bit more problems with programming, we have typically specifically connected with their health teachers, because there's almost all health curriculums are going to have some concepts similar to what it is that we're looking at. And most of our districts that we connect with when we're talking about their health curriculum, they haven't been able to buy new books for, I don't know, a decade or two. And so a lot of the health educators are eager for more accurate, up-to-date information. And so that's one of the ways with some of our districts that we have been able to bring some programming in, because the programming is curriculum. So it's not an outside group. And what we have done with that as well is we let the teacher teach it. So we don't come in as an outside agency. It's not somebody coming in to try to tell them what to do. And so we have found that to work with some of our districts, that when we've tried just to bring programming to them, they've always pushed back a little bit. And then we were able to connect with their health teacher, who said that, like, they're like, we don't talk about vaping because vaping wasn't around when our book was, and they're like, we don't know how to talk about this. And so when we look at some of the programs that we present to address the gaps, and then the data that we have, connecting with health educators is a really good way to do that. And then if you get that opportunity, you at least can get some kind of data around that. I know here locally, one of the things that we asked was to take out the LGBTQ question. We don't bring that question in there. Yeah. Because I was like, wow, that is a big part of what we look to do, but our whole LGBTQ efforts that we do here locally, we always focus on 18 and older. So that way because it's so tricky, and even here in Northwest Indiana, it can be very tricky to get and connect with youth because of parents. So our LGBTQ efforts are always geared, and all of our data is looking at 18 plus. But when we're collecting our data, we ask very specific data pertaining to high school and middle school experiences. So, while they're not in that moment at this time, it's still data that we're able to use. The other thing that I would maybe think about kind of with data, like we've done a few things where you just try to, like you're saying, kind of collect it on your own, kind of simple little surveys. We've done a few things with like our county fair where it's like if you pay to have a booth, they can't determine what you do or don't do there. And if you got some good enough giveaways, you're going to get some kids that are going to come up there. Yep. And it's parents who bring them and drop them off.
Yes, right.
And so, so sometimes it's getting a little bit clever around that. But I know the struggles with kind of that, a little bit of a movement that has taken place around the idea of social emotional learning. I typically don't use those words or refer to anything as SEL. Right now, I focus everything around the mental health of your students because of COVID. We know, and I leave it at that. You know that, your students are struggling, their mental health is struggling. Where can we support that, and kind of keeping it very relevant to just right now and today, as opposed to talking around social emotional learning, because for some reason, even though it's the same stuff, and it's been stuff that's been used before, it's not like any of it's new, it's just was getting a little bit more organized that has brought this about. So the other one that I would say as best as you can is educating your local politicians, which is a very tricky thing to do because I suspect you probably work off of the block grant. And so we have a very thin line between educating and advocacy. So try to really keep it on that education side of it so you don't lose your funding.
But there is a difference.
There is a difference. There is a difference. But that's challenging. And it's challenging. Especially when you don't have as many schools just to pull from. So I would kind of look at, think of connecting with health educators and health teachers and bringing it kind of in that way. Because a lot of times we didn't even need to get like school board approvals. It was just building level approval that says, yeah, you can use this as supplement to your outdated curriculum. Yeah.
We've done that.
We did get in. We weren't in Warsaw Community for years, and we did connect that way with the counselor.
Yeah.
And now we're going to be teaching a program called Wage.
And and it's kind of it's finding those ends or finding that good school resource officer who can pull your who will pick up your call and it's challenging. It's really
Well, if we could get him over in Kosciuszko County, that'd be good.
No, I think there would be some people with Hilbert that would be quite angry if we let that happen. So yeah, it's one of those things where there's no answer to it. But it sounds as though you're tackling it from a lot of different angles. But I think what's also important to understand is that you in Kosciuszko County, Kosciuszko, correct?
Kosciuszko.
Yeah, it's not unique to just you in Indiana. There are a number of other communities across the state that are also dealing with very specific efforts that are trying to prevent prevention.
And then another issue, sorry, I'm taking up so much time, but another issue that we have with the surveys is they always, do we have TPC people in here? They always seem to be so far behind. So my son was one of the youth that was up here hosting the panel, and he was like, Mom, why are they asking about Juul? Kids don't really use Juul anymore, but that's like a specific question on the survey, but they're not asking about Hyde or some of these other products that are really popular with youth now. And I understand there's a process through the state for good reason, but it seems like we're constantly behind the eight ball because of all of the red tape and the layers that we have to go through with those surveys. So I know I'm probably, I'm sure you're well aware of what I'm talking about, but it's just a huge issue when okay, well, we're collecting data that we have about Juul now, and we know, okay, most youth aren't using it, but we're asking nothing about all of these other products, or even specific in our community. So again, my son has shared with me that in our community at his school that LSD is becoming more popular. That's not even talked about really when we're talking about substance use prevention. That's like old school when I was a youth, or even, before that, and it's not even on their radar. And it's like, so how can we get with the times and try to stay ahead of that curve, but get through all of that red tape and those layers?
That's because I think it even goes higher than TPC, because they're a part of, they utilize and go into more of that national level data collection. And so, I mean, it is a process to get it to the communities, and it takes a lot before it actually gets rolled out. So, I mean, I think that's one of those where, utilizing this kind of data, I find to be very good to create kind of a wash of a community. Again, it's, if you're working in, any county, it's going to be a little bit different in different parts of that county. And sometimes you get in even to a community or a city, it's going to be a little different in neighborhood to neighborhood. And so while this is not an exact, it's enough to give us an idea of what has worked, because I think, one that I really steer to is look at all of the work and effort in tobacco, specifically cigarettes, and how that has worked. There used to be a lot of funding to support that. And I think because of all of that funding and all of that work, we did see good progress in that area. We are seeing progress in other areas, but then, we're fighting a battle right now with marijuana that is, who knows what that's going to be looking like, within the next legislative session. So, I'm so sorry, you're not going to have a chance to talk at all. Yeah. Yeah, there are those who are going to listen, and there are those that don't want to. And I would keep looking at those that want to listen. And so, poor Sherry's been sitting here. Sherry's going to give more, she's going to talk about some of the firsthand experiences, looking at the youth that she has been working with and looking at kind of the data and the struggles that she has seen them experiencing today.
Good afternoon. I've been doing this, as we stated, for about 34 years, and you can see the changes from organic leaf-like products to the vape cartridges to regular smoking of tobacco cigarettes to the vapes. So what I'm seeing with my youth, and I think we're seeing it culturally, is just the inability to be okay with discomfort. It's a quick fix medication for this or that. I follow Cleo Wade, a poet, who often states it's okay to not be okay. We try to remind ourselves that if we have a coping skill and we can work through it, it doesn't have to change by using a substance right away. Sharing along with your talk about the parents, SAFE has that statistic that says that 80% of young people ages 10 to 18 say that their parents are the leading influence on their decision to drink or not. So when we do home visits as probation officers, I always say, show me your room. Let me see what's in there. Because that is where they're going to promote themselves. And oftentimes I'll have to bring a parent in and saying, do you see this leaf product? Do you see this alcohol collection? Oh, yeah. I mean, we share these with him or her. So you see a lot of permissiveness. We had a parent who lost his daughter to heroin overdose. And he was very clear saying, what we permit, we promote. And I put that up for the families to see and the parents that I work with because it's very true. And so especially with our parents. Again, that feedback to the kids, it used to be, well, marijuana should not be legal. That's what I would hear. And now that it's legalized, it should be legal here. And there's no understanding in the adolescent mind that it's not going to be legal for you. What we see with mental health and what I'm seeing with some of my youth is either between the feelings of anxiety or depression, they're substituting prescription medication with THC or other substances because they don't like the side effects. I have a youth right now who's had very bad side effects on prescription medication. And again, that not being able to handle the process and being uncomfortable in dealing and managing with the mental health until you can find the right mix of medication, they will substitute the marijuana. And then when you're doing that with medication, that's poses more problems for you because your medication is not going to work as it should. I also have parents who say, well, we're going to manage without medication, which I'm all for, but then we have to manage it. Then you have to find the right management strategy with a therapist and someone who can help you with that. So those are the trends I'm seeing is substitution. I'm seeing Lake County, again, we were talking about the differences between, northern, middle, south, and you used to see a vast cultural difference between vape cartridge use and organic between the different areas, because I would hear some of the young people I worked with say, I'm not going to deal with that. I don't know what's in there. That's not pure. So, but now I'm seeing more cartridge use. And what the feedback I'm getting from the young people I work with is, again, they can smoke that a lot and with little detection. As when you use an organic leaf form and even cigarettes, at some point your throat starts to hurt a little bit. And so sometimes you take a break. And so when we see the vape use, it's very social, it's very frequent. The percentage, you're talking 90, 80, our school resource officer could tell us, 80, 95%, THC levels in these cartridges. When I talk to my school resource officers, I get a show and tell of everything they've confiscated. And I don't think a lot of parents know how to tell a THC cart from a nicotine cart. So when I talk to my school resource officer, he just shows you. A THC cart that's not in the battery and not heated up is not going to flow. It's going to be solid in there. It's more like a gel. Nicotine will rapidly flow back and forth. It's liquid. So, informing and education, as we've talked about here today, is very important because our parents can't look at something and say, that's definitely THC. I'm sure, again, our resource officer, along with myself and Mr. Evans, parent permissiveness and not saying, well, it's not that bad. Their influence is huge, and it's regrettable. The youth also with their peers. I have a young man who constantly is using the THC carts. And his therapist worked for Change Therapy out here in Valparaiso, stated that it was more for social and peer acceptance, that they did not find another point behind the use. This young man also was found unresponsive by his parent. Thank goodness his parent walked in his room. How many of our kids are left alone for hours and hours, right, in a closed room or in a basement? And found his child and was able to take the child to the ER and get help, because that child did do LSD with THC with alcohol. Our kids are mixing. And again, when we talk about suicide, there's the intentional suicide, and there is a suicidal mindset of, I don't care what happens to me. So when you talk about the binging and the mixing, it is really, I'm just gonna see what this does. And if I don't wake up, I don't wake up. And that's very unfortunate. It's important to ask the tough questions, especially in my field, and be direct. I know I took a lot of, again, I don't know how many students we have here, but we took a lot of communication classes and a lot of interviewing skills. And I know there's different modes of thought. I have had the most success in the probation world asking the least offensive question or challenging question first, and then going up from there. But you have to go up from there. But there's other modalities, especially the mental health initiative, that's going to tell you that you need to directly ask that person, do they want to die? You know, are they thinking, you know, that they don't want to be here any longer? So have they attempted suicide? Do you have a plan? And what is that plan? And is that plan something that can be carried out? You know, do they have access to weapons? And when they're mixing substance abuse, even Tylenol hurts the liver. So I've had kids, you know, I had a young lady who was in the hospital 3 days, overdose of Tylenol. So the trends I see is that I'm seeing a lot of inability, very few coping skills that my young people have to manage discomfort, whether it's anxiety, depression, stress, not being accepted into a certain group, and then not knowing how to manage that and opting for substances. The vapes are causing agitation because, again, a lot of times some of those cartridges have such a high nicotine percentage and they smoke it so much more. Again, I'm trying to remember if one card is a pack of cigarettes or 2 packs of cigarettes. So these kids can go through those pretty quick. And so what would take us longer, because it's just the process took longer, and your body would tell you, I'm done for a while, these vapes are a whole nother ballpark for the young people. So I'm seeing a lot of that being problematic, and the agitation, and then that disrupts school and their performance. I do think we need to get the parents involved. I think we discussed that a little bit. And agencies outside of school as well, because again, we have kids that they're brought their stuff to their window. They could be on in-house arrest. I had a heroin user violate on in-house arrest because they brought it to the window. And then nobody was monitoring him and supervising him, you know, close enough, figuring he was on in-house arrest. So it happens, and it's easy access. I will say that, especially in certain areas, drug dealers are, I would say, people who sell and supply the vapes are saying, here, I'll give you a free one, and if you sell 3 for me, we're even. And so easy access and being exposed, and that first time in using is something that shows you how easy it is for you to gain access. And again, the young person has the added benefit of earning some money. So I guess those are the challenges that we see. They are real. A lot of young people with dual diagnosis are really struggling, and I'm seeing that in treatment. We haven't found, you know, a wholly effective form of treatment to really bear down on it, especially when someone's really struggling with significant health challenges and mental health challenges, and either are not okay with medication, or the medication just, they're not finding it. We have a shortage of psychologists, we have a shortage of psychiatrists. So we're seeing shortages all over the place, including, you know, at school and different places. So these are ongoing challenges for families who do want to work on these. issues with the young people. And again, there is something called JDAI, which when we talked about the lack of accountability, the accountability has to come from the family. And because the court, with the initiative, we're going to educate. We're going to hold them accountable and, trying to work through conflict cycles, et cetera. But the accountability does need to come from within, with the family. That's going to hold the most weight for the young person. It can be done in a timely manner as well. So, thank you. That's all I have. If you have any questions, you can let us know.
So one of the questions, well, not one of the questions, I guess one of the thoughts I had, which led to this question is, has anyone ever thought to talk to the parents and providers about mental care before they talk to the children in the schools? I don't know if that's a weird question or not, but okay, like how I was wording it, The reason why I'm asking is because something like that actually came up recently in one of my classes, and we were talking about statistically how a lot of minorities don't get therapy because of their parents, because their parents didn't feel like they needed therapy when they were younger, and it's generational, and there's so much trauma and generational things going on there that was never tackled. And so when it comes to the child, they're just left to kind of figure things out for themselves and look to the school for help. And obviously I love when the school is able to help and when we're able to provide those resources. But at the same time, as you said, there's so much pushback with parents. And so I guess I'm wondering if you all have maybe had meetings or sat down with the parents. Obviously not every parent's going to be like, yes, I'm totally on board, but I don't know if the conversation's ever been had, maybe even just one-on-one, to even, talk about therapy in general, and seeking help, not just with the child, but just as a family dynamic as well, and just to see what that looks like.
That is one of the things that we have tried to do and we continue to try to do is give opportunities to have conversations with parents and caregivers. It's challenging. It's challenging to get parents and caregivers there. They have been on some more general topic, safe conversations. And then we've had a couple that have been, very specific, conversations around, for example, suicide. And we've tried to do it in manners where childcare is provided simultaneously because, thinking of like barriers. What are barriers that could be presented to a parent that like, I can't get to this because, where we've provided food, we provide incentives as well. And it's still very hard. But one of the things that I have seen kind of as a big barrier is the family, and I think if as a community, when we're looking at some of these areas, if we can really look to address the stigmas around it, that the families don't have to have that sense of shame or that, I think some parents feel as though they failed. If their kid needs to go talk to a counselor, they feel they failed as a parent. And so sometimes it's their own pride that is preventing the opportunity for their kid to get the care that they need. And so I think if we could continue kind of like on a community level approach to reduce the stigmas around addiction, around mental health in those areas. And if we can allow the conversations to be had in different places as well. Like I would love, and one of the places that we really try to connect with is the faith community. but it's very challenging to get in with a lot of the faith communities to go in and have conversations around mental health or to have conversations around substance misuse. But it's like, okay, but we're still constantly looking at who can be those partners of finding parents where they're at is one of our approaches that we really try to do, as opposed to, I very rarely expect parents to come to me. I always think, where can we find the parents at where we can have those conversations and safe conversations? So I think you're right on with, we need to have those conversations with the parents and caregivers.
And that's a great question, because I would say that when you're working with a family, being able to identify that as a possible barrier is very important. And then, again, I would usually ask the young person to go have a seat out in the hallway, and I would talk to the parents for a little while and try to get them on board. But the success of the therapy, if at home they're hearing, this is nonsense, you don't need this, you shouldn't have to go, then that's, counterproductive. So trying to get them on board, and I know I had cultural is very true, and the shaming and different disciplines are something that I've addressed over the years as well. I had a young man from Croatia. The family was from Croatia, and so the Serbian culture allows drinking. And so the parents were very much against me telling the young man he couldn't drink alcohol because it's allowed in that country. So again, I said, I can't remember what the Serbian faith leader is called, but who is your person? I need you to go have a talk with that leader about what it's like to live in the United States and our laws regarding alcohol consumption and the conflict that you're having with how you grew up. Because I understand it, and I get where I hear you, but I just didn't want his son to have to pay for father's, history and what his belief system was. So yes, you're right. We need to get the buy-in. I think that's everybody's struggle about how to go about that, is to put that time in up front to get the buy-in.
So again, we're actually from a different community, and we really struggle with our officials, particularly our probation department. Do you have a teen court here? Okay, so typically what happens in our community is if a student is caught vaping at school, typically they're written a ticket. It's about $200 in our community, or they're given the option to go to teen court. So that ticket goes to the probation department, and the probation office handles it and outreaches to the parents. And they see it as a nuisance. They see it as very low on their priority level, that it's nicotine. Why are we even bothering with this at the probation department? So how can we work better to educate them and to get them to understand that it's really just as important as anything else that they are doing?
I know with our county, because we don't deal with the nicotine. That is the town courts that handle that, and probably the teen court. So the probation department really doesn't. That is a different jurisdiction. I know our chief and staff, they tried to have liaisons, people who can talk to each other, because if we don't hear what the struggle is, if we don't know, what you're combating, yes, I know I've got this murderer over here and I've got this rapist over here that, I got to spend some time on, but this young person, it's all perspective for each person. And this young person, could live a different life if they're not caught up in, the vaping and the THC and what all that can turn into. So just understanding that everybody's struggle is important in trying to address that. So I think that's a liaison issue and maybe a communication and understanding issue, versus saying, we don't have to pick which is worse, because everybody's got a story. So we don't have to say mine's worse than yours, you know what I mean, or this is worse than that. But this is an issue for youth, and I think it's neglectful of us to just ignore it. So I don't know if you can try that, and maybe you can get a conversation going between the two. I know our chief is very open to having conversations. I hope yours, is, or somebody within the department might be open to having that conversation.
Yeah, and I would suspect you probably have offered up your own services to take it off their hands. And I think sometimes, it is us community partners that can come and say, hey, what can we do to support you? And, with your caseloads, are there things that we can provide? And so where you might be able to kind of, they might be able to funnel some students or some families that need a certain level of support that your agencies with your programming could potentially provide is always a good thing as well. To try to establish those relationships and maintain them can sometimes be challenging.
We hear from the kids all the time in teen court that their parents don't care. Right. They don't care about their grades, they don't care what they do, they don't have a rule, and, they may not say it, but kids want that.
They need it.
I was going to say, my kids in detention, when I was a detention officer, they respected the DOs that enforced the rules. The ones who let them get away with everything did not respect them because they really did want that structure.
Do we have any other questions? All right. Who do I turn this over to? All right, I think we're good. No other questions. Thanks for your time today. Thanks for the great information. Appreciate it so very much. We're going to go ahead and take a short break. There's some snacks that they brought in. A lot cookies and some trail mix back there, lemonade, iced tea. So go ahead and we'll take about a 15-minute break, and then we'll gather back in here for our final session.
another one out there somewhere too, I think on one of the tables. I don't know what happened to it. It was back there. The other mic. Yeah. All right, we'll get started with our 2:45 session. Good afternoon. I am Joe Hall. I'm Captain of Support Services at the Valparaiso Police Department and the Executive Chair of the Tobacco Education and Prevention Coalition for Porter County. So with both of those titles, I would like to say thank all of you for being here today, and I hope if you found everything as entertaining as I have, it's been a pretty good day. And this presentation will not lack or take anything away from that. These some very dedicated professionals here that will be speaking to you on the topic of what is that? And I think they're going to answer that question for you. As we all know, vaping has become an epidemic among our teens and young adults, and it is no different here in Porter and Lake counties. Our school personnel are forced to deal with the fact that vaping has changed the learning environment and the school culture worldwide. Today, we are honored to have two experienced school resource officers. First, we have Chesterton High School's Sergeant Chris Swickard. Sergeant Swickard is a member of the Chesterton Police Department for 23 years, serving 8 of those years in the school systems. We also have Sergeant Monte White from the Hobart Police Department. Just Monty, okay? Who has spent the last 5 years of his 18-year career inside the schools of Hobart. Each will share their behaviors or the observations and behaviors of the current cultures in the classroom among adolescents, as well as paraphernalia commonly being used and confiscated during and throughout the school day. Our final member of our panel is Valparaiso Police Department's police social worker, Sam Brigette. She'll be here to provide resources that are available to parents, school personnel, and the general public. Although Sam has only been with the police department for a year, she has a vast amount of experience in coordinating community partners, including her own community partner network, which collaborates on resource sharing to help boost the access of resources to those in need around Porter County. She also teaches adjunct in the Valparaiso University's sociology department. Welcome Sergeant Swickard, Sergeant White, and social worker Sam Brigette.
Hi, how are you guys doing today? Listen, I apologize ahead of time. I'm used to talking to high schoolers, so if I say something stupid, like just don't hold it against me, okay? So I'm Officer Swickard. I work at Chesterton PD. I've been in the high school for 8 years now. I came in there in August of 2015. When I first came in there, what we first started dealing and seeing was a lot of tobacco stuff, cigarettes, and then even chewing tobacco. Is this better? Oh, that sounds weird. All right, we saw cigarettes, chewing tobacco. We'd see that sort of stuff a lot, and then the electronic cigarettes started coming in. So I would say probably 5 or 6 years ago, the Juuls were really big. Since then, we haven't seen them. When they changed the laws, the Juuls have kind of died out. Okay, we realized quickly that it was a problem. We were getting 7 to 8 students a day that we were catching with Juuls and e-cigarettes. So we were suspending those students out. So they were getting the first time offense was a 1-day suspension, and then after that, it would double. So we tried to figure out something to do to kind of curb that behavior besides just suspending them. So what we started doing is I started writing tickets through the state. So we write a vaping ticket or a possession of e-cigarette ticket to them as well. And that kind of slowed it down drastically. We're down from like 6 or 7 a day to probably 1 or 2 a week now. Duneland schools have also just installed vape sensors in their bathrooms now. Right on cue, it's just going off. I'm getting an alert. They're constantly going off. They're all, there's another one. So I got 2 of them back to back. So they work really well, but they keep us on our toes. This is probably the biggest thing I deal with over at Chesterton. I'm not sure what, Sergeant White does over there at Hobart as much as we do, but this is our number one thing for us. This is constant, like every day we deal with this. It's estimated that in our school, our kids say about 50% of the kids have a vape on them. When you look at over 2,000 students, you're talking 1,000 kids are walking around with vapes in the school every day. It kind of seems high to me, but then again, we start looking at it, we're finding them everywhere. They stash them in bathrooms. They'll stash them up in the toilet paper thing and tell their buddies where they're at, and that's where they go share them at. They'll hide them under the trash bags in the cans. They'll pull the bag out and hide them underneath there. They're hiding them under the sinks. They're hiding them in ceiling tiles, and they let each other know where it's all at, and they share it all. So what I find mostly are like the number one popular one here for us is the Mr. Fogs. We're seeing these a lot. These happen quite a bit. I think the kids like them because they come with this fancy lanyard they wear around their neck, and they carry them with them that way. I've actually had kids come into school wearing those around their neck still, And that's how we actually caught them wearing at school, believe it or not. The next one we see a lot of for us is the ELF bars. These are the second, probably most popular ones we have. Again, these are, 6,000 puffs in each one of them, they say. The kids like these a lot because they're all flavored. They don't like the regular tobacco stuff because it has no flavoring to them. The kids will tell you that it's safe, it's harmless, we're gonna use it, and it's good for all of us. So we've had them where they're vaping in classrooms. They sit in the back of the classroom and they'll vape, and they can blow it down their sweatshirt, or they'll blow it into the sleeve of their sweatshirt, and the teacher never knows it's going off in the classroom. They're vaping on buses, they're vaping in the bathrooms, obviously, is a hot spot for us, which I'm sure is the same thing over Hobart. But really, that's about all I got so far. So here you go.
Well, it's nothing I like to do better than talk about my collection of goodies there that we confiscate. And just like Sergeant Swicker said, over in Hobart, we deal with the same things. I remember when vaping first started to come to prevalence in the schools, we were getting 5, 6, 7, 8 a day, and we weren't doing nothing, and anything seemed to slow those guys down. So what we did wind up starting to do is write citations. And our citations, I know it was brought up through another presentation, our citations go through our city court because there are infractions, and our city court was more than happy to deal with them. One of the things that we benefit from in Hobart is that we have a good working relationship with our mayor, with our city judge, with our superintendent, and with our police chief. So they all get together and they all recognize that there was an issue going on with the vaping epidemic. So that's where the citation came about. And as Sergeant Swicker was saying, we do see some of the same things. We were seeing a lot of those things. And once the citation came down, it really cut down how many vapes we were seeing in a day. Right now, I'm seeing a lot of the Max Air Fog Pros still. And if you look at those vapes and you look at the difference, remember in the beginning when Juul was around, which nobody Juuls anymore, but I'm sure even Sergeant Swicker to look at those, and remember you couldn't walk around without tripping over one of these caps. You look down and you'd be like, hey, there's a Juul pod cap. And we all remember earlier that it was mentioned, hey, this is equivalent to 1 to 2 packs of cigarettes. Now you get to that Max Air Fog Pro, which is what, 3,500 puffs, 4,000 puffs. If every 10 puffs is a cigarette and every 200 puffs is a pack of cigarettes, you've got 4,000 puffs in one hand. This is what students are using. We're also seeing the same things that Sergeant Swicker was talking about, where students go in the bathroom. They put the vape in the ceiling tile, they put the vape in the toilet paper tube, they tell their buddies, they go in there and they keep hitting the vape. And this is all they do all day long. So the bathrooms are one of our biggest issues as well. We go through there. I generally pull out tons of stuff through our bathrooms. Another thing that we pull out quite a bit as well are the THC carts. If you have a chance, this is what a THC cart looks like. This is how small it is. Sometimes they shove it in the toilet paper roll, sometimes they shove it in the toilet paper tube. And what we found now is we get a lot of students, they'll put this in either a roll or a ceiling tile, and they'll hide it there, and then students are just carrying the battery around with them. What this is this is just one of the batteries that we see here. This is called a 510 battery, and that's due to the threading of the battery. That way these batteries only fit with these 510 threads here. So students were trying to get around us that way by carrying just a battery. So, hey, I just got a battery, you can't get in trouble for that. Well, that was wrong too, so we started writing them for drug paraphernalia. So some of the things to keep an eye on and keep aware of, and also that I do on a daily basis, not just simply search bathrooms, search students, and search stuff. I actually go to a lot of homes. A lot of parents reach out to me and they say, hey, I found this is going on, my kid's acting strange, my kid's acting weird. And through some of the great information that was shared with us today, we see how vaping, how nicotine, how THC addiction affects how kids behave and how they think and how they act. And by going home and by having parents get concerned and calling me and saying, come look it through this room, come search this room, come see what we got going on, these are all of the things that I tend to find. Everything up here has been confiscated from students from our school, either through their bedrooms or in their vehicles or on their person, or the next best thing, their backpacks. So there are signs and clues in everything that we do and we have to look for. For some odd reason, when you go into bedrooms, I don't know why students like to keep these things. They like to keep trophies. So if you see a bunch of cigarellos or cigarello wrappers, we learned today that through directed marketing, that they are targeting our youth through our flavored marketing and so forth. But they tend to keep these trophies. These are signs of possible drug use. Pay attention to those. As we keep looking, there's also the stash jars. They come in different. There's the mason jar. Here are the rubber stash jars. And again, when the presentation's over, you're more than welcome to come up here, touch everything, open everything up. They're just regular jars. They're not airtight or anything like that. I have a little bit of everything up here, but some of the other things that this behavior leads to is some of the negatives, some of the fights that we have at school. We actually suspend more kids over fighting over vapes. Someone takes my vape, now I gotta go get it back. Now we're fist fighting. Now we're going through all of that. I still do find a lot of flower product up here at the schools as well. This in these cans, it still comes in the traditional plastic baggies as well. We still have a lot of students who tend to traffic marijuana through schools, so I still make quite a few arrests. And that was just one of the things we were discussing a little bit earlier. This school year has been quite hectic already with juvenile misbehavior, and we're trying to get people back in line. One of the things that we do is not only do we, as an SRO, do I believe I'm here to, discipline people, but I'm also here to teach you the right way and help you correct your actions. So we also teach a drug trend series, and that's myself and Miss Mathis over there. She teaches with me. So once you've been caught, once you've been cited, once you've come through this process, you come to the class and we discuss, hey, how can we get you past your addiction? How can we get you out of this state? How can we get you on the path to being right without any further legal actions? Because legal actions is not the only way and not the only solution. Also going through rooms, there's some things, and going through backpacks we should also be aware of. Scrunchies that have safes or zippered pockets in them, Sharpies that are stash Sharpies that you can take apart and put items in. We have plenty of students who think that they're slicker than the rest of us and that they know better, so we have to go and we have to deal with that. You have students who often drink in school, something to be aware of and pay attention to. We have a lot of these can covers. It looks just like a Sprite. Slide it down, and it's just a regular can. It might even be a can of beer or something else, so pay real close attention to those things. One of the things I've been stressing to our nursing staff lately, and that was brought up to several times today, is that the health effects of vaping. Like if you have students and they've been vaping since the 6th grade, since the 7th grade, then of course when they haven't hit that vape in quite a while, their stomachs start to hurt, their heads start to hurt. What do they do when their head starts to hurt? They want to go to the nurse. Now they're making several trips to the nurse. Let's pay attention to how often they're going to the nurse. Maybe this is a sign that they have an addiction problem. Maybe we can intervene then and there, and we don't have to involve the law. So these are some of the things we really do need to pay attention to. No? I don't want to keep. We have those too. I turned everything off, so. So before I kind of wind down and turn it over, one of the pieces of resistance and something that was huge is like I went to a room to check for a parent, and this is one of our former students who had a really bad drug problem. He was doing hard drugs, I believe it was heroin. And right here is one of the tins. I know it was brought up earlier about LSD being an issue, which I have found several LSD cases throughout our schools since I've been there. And one of the reasons they do the LSD is because it has a half-life, it doesn't last long, and it's hard to drug test for. I was finding that this was an issue amongst all of our athletes. Well, I shouldn't say all of our athletes. Some of our athletes were doing that. They helped, I don't know why, I believe they said it helped them focus a little bit better. But this student was doing hard drugs. What you see here is the tin foil. The tin, this was actually in his room. Here's a makeshift pipe out of a pen that he created so that he can consume his drugs. And if you're not familiar with one of these or what this is called, I believe the nickname is, I call it a splooge. This is a paper towel roll or toilet paper roll. He's filled it with dryer sheets. So what happens is he would do his drugs, he would exhale into the dryer sheets, and on the other end, it would smell like Febreze. You can see the tar and all the nicotine that's on the inside. So these are some of the things that we come across in the school and with some of our students, and then we kind of question, well, hey, why are our students acting like this? Why are they behaving like this? What's the deal that's going on? And this whole table is an example of that. Nope, that is all I have.
So I'm Sam. I'm the social worker of Valpo Police Department. When I was asked to come and speak on the panel about resources, it really got me thinking about the lack of resources for some of this that parents know about or that we have accessible in the community. So I work in the field of substance use treatment. That's one of the many, I work with a lot of people who are struggling with hard drugs or alcohol. I also have a 16-year-old foster son at Valpo High School, and a lot of this stuff is super unfamiliar to me. So thinking about, all of the parents in the community that reach out to me and say, what do I do about this? It really has me thinking about, how are we expecting everybody to know where to turn to or how to help the kids? So thank goodness for the SROs because, they appreciate the watch and everything that dings when you're getting the notifications because it's difficult. I think for two reasons at the community level. First, vaping, I was largely unfamiliar, and working in the field, maybe it's just me, but I think it's really hard in the community to know where to go and what resources we have, like I said. I think that one of the reasons for that is it's largely, unless you're actually studying or familiar with the effects of vaping, I think it's written off as not that big of a deal, right? So a lot of the people that I work with who use substances, hard, meth or heroin or alcohol or whatever, for years, then they get off that and they're vaping. And so it's easy to say, well, at least I'm not doing that anymore. And so a lot of those in the recovery community, use vaping as, well, this is harm reduction, or now, I'm not using heroin, so that's great, but we don't know a lot about the harmful effects of vaping as well. I've had parents reach out and say, well, my kid is vaping, what do I do? They're already on probation or they've been on probation. So I've reached out to probation officers and they've said, well, it's just vaping, so what? And so when that's kind of the community attitude or, lack of recognition of the issue, then it's really difficult. If it's not an SRO connecting with resources, it is hard to go out there and actually find what they need. I was just in the breakout session talking about why are we vaping? We know the kids are susceptible to peer pressure and all of that, but if you go down to, well, you need all of these positive coping skills to be able to not vape, or the lack of base, the ability to take care of ourselves, it's hard to break it down, and we can punish, but also we have to figure out what do the kids actually need to replace this, which makes it really difficult. So. I also, in the police department, a lot of my referrals come after the person has, gone to the next level of drugs. So a lot of my referrals aren't, well, the kid is vaping or this person's vaping. It's, well, they started out vaping and then they started smoking weed and now suddenly they're, injecting this. So that's a lot of what I see. But when I do get referrals and whoever is vaping, it's also harder to connect with community level resources because it's not taken seriously in a lot of arenas. So I've had kids where I've gone to refer them to treatment for marijuana. And I've had, call agency after agency and say, would you take this kid for treatment for marijuana? And, if they're laughing at that, when you say I have a kiddo who's vaping, then, it's really hard to find somewhere to take you seriously for that. Although I will say, we are fortunate to have a handful of resources, which I've put info on the table straight out these doors if you want to check that out on the way. But I also love, my big thing is brainstorming and collaboration. So I'm going to talk about a few of the resources that we do have, and if anybody is familiar with others that I'm not mentioning, please speak up. So obviously the coalition is a huge asset in our community. I always send parents their way when their kids are struggling with vaping. We have the Hub Coalition of Porter County, formerly the Substance Abuse Council. So they do a lot of education in the schools. At Valpo Police, we have our SROs in the school doing the DARE program. Do you do DARE as well? Okay, so a lot of different programs in the schools. We know we have to get to them in the schools, ideally before they graduate and they're on probation or something like that. And then we're dealing with a lot more issues. So as far as education, we know we have to get it early, right? We have Recovery Connection in Valpo serving Porter County. That's a great resource. They do smart recovery, so thinking about kids struggling with substances, but also, what is happening in your brain and what can you use to replace these behaviors and things like that. They're a huge asset. 320 Artistic Recovery in Chesterton. They don't really specialize with youth, but they also don't turn people away. So they are a huge recovery resource. Valpo, in my personal life, I run a Unity Cafe in Valpo, which is really a therapeutic environment for anybody to come to. So I have some older kids where they're struggling from the isolation or substance use or whatever, and they're welcome to come there as well. We do a general support group and then refer them to Recovery Connection or other agencies. Counseling, of course, all social workers, I think, harp on counseling. So whenever anybody's struggling with substances, we usually refer. We do have a lot of resources for therapy, although it takes a long time to get into. But then, like I said, once the kid, a lot of this stuff is comorbid. So usually if there's one issue, it's not, just vaping or just one thing. They're struggling with many different issues. And so that's when we start looking at different residential, inpatient treatment once it gets to, a very, very serious level. And it's a lot harder to find resources for the kids once it gets, once it escalates and they actually need something longer term. So thank goodness for you guys, and they're doing the work early on so we can hopefully alleviate the need for that later on. Anybody else have ideas, good resource options that somebody else might benefit from? Yeah, it is difficult. Anything else? We can let everybody mess with the goodies? Okay, and if you all want to come and show and tell, check out the what the guys brought. Yeah. Questions, anybody?
Where do you get the vape sensors that you have in your bathrooms?
For us, the Porter County Safe Schools Commission did a grant, and
You got that grant. We have one in Lake County,
yeah,
too.
so we did we buy 5 and get 5 free kind of thing through that grant. So right now we've got 10 in our schools, we got 6 in the high school,
Yeah.
and 4 at the middle school, and we're getting more coming up here. So they just went in. That's why I'm still trying to figure things out.
Okay, because you're in Lake County, right? The Lake County, the Lake County version, are you all aware of the vape sensors? I contact the SRO and see if our county has that, so we could maybe, if they have them, they can purchase them or something?
We do have vape sensors in our school as well.
Did you get it through the?
We've had them for a while. I'm not sure how we obtained them. Our HR director was part of that, and our tech guy was part of obtaining those. I do believe it was through a grant. I'm not exactly sure what the company was, but we've been using our vape sensors probably for like 2 years now.
Exactly how do they work?
So the way it is, it's kind of like a smoke detector that's installed in the ceiling, the way we have it installed. And what happens is students go in there, they do a vape, or we've kind of tested with a few other things. They go in there, they vape, the sensor sets off after it detects vape odor or vape smoke, and then it sends out a text message to everybody who's on the staff. Just like his watch was going off, my phone goes off constantly. All our admin goes off constantly too, as well. And then what usually happens, if someone's close, we go to the bathroom, we get whoever's in there. If someone's on the camera, they'll jump on the camera and tell us like, hey, so-and-so just came out of the bathroom right around the time the vape sensor went off. So then we go and we wrangle them down. And that's when, again, I go search the bathroom, I go search the garbage cans, I go search the toilet paper tubes and things like that, looking for the vape that they may have disposed or if maybe they have it on them. Yes, ma'am.
Well, has vaping gone down since you've purchased the sensors? Have you noticed a decrease? With the vape sensors? Because I've heard that they also, that some other things might set them off, like certain cleaning supplies or things like that. I've heard that happens occasionally, but have you noticed a decrease?
Well, we were curious about the cleaning supplies too. We had heard that as well, so our tech guy went around spraying all our vape sensors with cleaning supplies, which he was already weird to begin with. So far as it going down, I want to say it did make an impact, and it did get in there, but once students were aware of what it was, it just kind of shifts it to other bathrooms. Like we have vape sensors in maybe 4 of our bathrooms, but that's just a small percentage of the bathrooms we have in the high school. So once they're aware, they would even ask me, like, Officer White, is that a vape sensor? Like, no, it's a smoke detector. What are you talking about? Like, yeah, whatever. And they just shift the problem to another bathroom.
Yeah, I would say ours is about the same way. The bathrooms, when they first were going in there and we first put them up a couple weeks ago, they were constantly going off. Now they've kind of figured out that the upstairs bathroom doesn't have one in there. So that bathroom, we look at the cameras, we'll see 30, 40 guys going in one bathroom, which we know what's going on in there. Ladies' restroom, same way. So they just, again, like you said, we don't have enough for all of our bathrooms yet, but that's coming down in the future.
So I have a sibling that's at Chesterton High School, actually, and she said that she had an experience where she and the other students are searched on their person, like their bras and things. What's the procedure? Do you check students and on their person for vapes and those types of things?
So we do check them, but we do not. I have never checked a bra, and I'm not going to check a bra. I like to keep my job, so I don't do that. The school staff, they don't even do that as well. We do have metal detectors. They've wanted them in the middle school to try to do it that way. But, again, with the bras, the underwire will set the metal detector off, so it's going to give you a false reading on that. We don't do it at the high school. We don't even pat them down unless it's a weapons case or something like that. I think they have a weapon, we'll pat them down ourselves. But we just have them turn their pockets inside out and then run their thumbs around their waistband. We do not have them check their bras. And the sad thing is we know that's where their girls are hiding them at. So it's kind of one of those things where, am I going to risk my career to write a ticket for a vape? No. Anybody else? Yes.
So can you tell us a little bit, because I know I've had previous conversations with you, and it kind of blew me away, but you had made comments in previous community conversations about parental assistance with purchasing vapes, and also we're talking about usage a lot, but there's a lot of dealing that goes on in the schools with vape materials, and I know I've gotten some of those confiscated materials from you. So can you just talk about the other things besides just pure use, but what other kind of behavior you see going on?
Yeah, I mean, we have a lot of kids that'll bring them and then, they sell them and buy them. If you got an older brother or someone that can buy them for them, they'll bring them in there. I also find out from the kids what gas stations are selling them. So I make a lot of phone calls to excise a couple times a week usually. Like, hey, this gas station's selling underage. The gas station right by the police department in town found out that if you were a cute girl and went in there and kind of smiled and flirted with a guy, he would sell them to you no matter what your age was. So called excise on that one a couple of times now. But yeah, the kids bring them in, they sell them. It's a money-making thing for them too. You'll have kids that'll walk around with a battery for the THC and just really looking for someone with a cart because they know that someone has a cart, they've got a battery, and they just start asking around. So it's in everywhere you look, and we find them in backpack straps. They'll hide them in there. A lot of the times, the guys will give them to their girlfriends to hang on to them. They know that we're not searching certain areas. So the girls are the mules, so to say, for the boyfriends we're finding a lot of times too.
Also, something I didn't really touch on earlier, and Sergeant Swickard hit on it on the head, like finding things in backpack straps. You really got to pay attention to the clothing that our students are wearing out there. I mean, sometimes they announce their drug use right there on their backs or on their chests or on their backpacks. Things like spray grounds, we've all seen those backpacks, are all colorful. They have many hidden pockets in them, many stash pockets and things like that. Some of the shoes and some of the clothes that they're wearing, like cookies or Rip and Dip, which is the little cat with the middle finger on there. You've probably seen some of these things and never even realized what they were. But this is the drug subculture that our kids traffic in, our students traffic in, and they deal with every day. You listen to some of the music, and they're just outright talking about drug use. So they're out here using the language, and they're out here advertising it. So sometimes we just have to pay attention, and we have to really know what to look for, especially on pat-downs and searches. Again, like Sergeant Swickard, I don't get involved in pat-downs and searches because there's just a certain line between police and school officials. All our school officials do those things, unless it's a school safety issue or an immediate threat. But we all know what to look for. We all know where things are. We all are aware of the stash pockets and clothing that are built specifically to hide drug use and drug paraphernalia and things like that.
I think something else that I've seen a lot among parents and myself and students and teens that I've talked to is not actually knowing what's in them. So it was Carrie's presentation a couple weeks ago, actually, where she showed us the vape juice and said, guess how much water? Oh, 0, there's no water in here. And I talked to another parent after the event, and she said she was so excited. She went home and told her daughters who are in their 20s about it, and she said, guess how much water? And the girls are like, I don't know, like 50%. She said, no, there's no water. So even, I mean, a lot of the times, even the kids don't know, you know, like, is there nicotine? Is there THC? What's in it? So then when kids don't know and their parents have no idea and their parents come to somebody like me that also doesn't know the difference in all of them, you know, it takes a lot to figure out what are they actually using and then what do we do about it? Another question?
Can you tell us from your perspective, what can those of us in public health, how can we work with the schools and get schools to work with us in order to help you help your students? What are we not doing, or what should we be doing better?
I'll jump in first, I guess. Like I say, in Hobart, I benefit from the good relationship we have with our city court, with our mayor, with our superintendent, and with our chief. I mean, our mayor used to be a SRO at one point. So they all kind of work together and get along. They all see the need to have a healthy community of young people who grow up in the community and provide and put back into that community. So they've all been beneficial. So if I was in any other community, I'd say it's developing that relationship with all the groups and getting everybody on one page and one voice. That way, when those parents who don't want to cooperate kind of buck back, they know that, hey, everybody on the other end is on the same page. This is where we need to be. This is where you need to be. And this is going to help you in the long run as well as your student.
And I agree with all that. And I would say the only thing I would add to that is if we get the parents on the same page, a lot of times the parents are buying it for the kids and sharing it with the kids. And they say it's harmless, it's an e-cigarette, it's not tobacco, it's not cancer causing. So getting the parents educated on the same page as the kids is probably the best thing we figure out how to do, short of having, you know, an adult in every single bathroom all day long. That would be the ideal situation. It would solve it that way, but that's impossible. So.
So my son was here earlier. He was one that did the interviewing with the panel of the adults earlier, and he's actually a youth inspector with Excise Police. And they have issues in our area with retailers who no longer even have a license to sell tobacco because they've sold so many times to youth in our community that they've lost their license, but they're still selling tobacco. And this particular retailer, all the kids in our area know, if you want to go there, you can buy, but it's kind of a cat and mouse game with them, and now they've set it up. There's a password that the kids have to know. So if my son goes in and asks to buy an e-cigarette, they're not going to sell it to him because my son doesn't know what the password is. But the kids who know what the password is, they go in and they say whatever it is, and they're like, they get this bag out from underneath the counter and they say, what do you want? Because legally they can't even sell products because they don't have a license anymore. I mean, have you ever dealt with anything like that? And what can we do to try to, you know, personally, if you've been in here, you know, I've been asking questions all day. I'm the type of person, like, I say, let's get it on the news and say, do you know that this retailer is selling to our kids? But not everybody in my community believes that way. But what can we do with these retailers who are knowingly selling to kids?
Well, for us at the police department, that's kind of a hard thing because we don't really enforce those laws. So that's where excise has to come in for us. Excise, every time I've called them, been great. They come out usually within a day or two and start looking into that stuff for us. But, you know, when I grew up in Chesterton, so born and raised, the same gas station these kids are buying from now, when I was in high school, that's where the kids went and bought cigarettes. So it's an ongoing thing. It's a generational thing. Short of like chain locking their doors shut, I don't know how you fix that. Maybe get the legislation involved, make, you know, tougher fines and penalties for them to do that. That's probably the only way you could really do it, I would think.
Yeah, I agree with that. And I also think that a huge part of going towards fixing that stuff is the relationship you have with students and getting them to buy in to being healthier. And then they also know well before we know that, hey, this guy's still selling, he's gonna keep selling, this is the password, this is where that. If they're willing to share that with you, if they're willing to go ahead and they're sharing it with others and tackle that issue as well with you, this is part of that community question from earlier, is we're all together, all in this together, all to be healthier and available. It takes the community as a whole to buy in and defeat that person.
So the excise officer, so my son's supervisor actually reached out to him and said, can you try to figure out what that password is? Like, can you, like, you know, because they can't catch them in the act, because if they were to send someone in without the password, they're not gonna sell, and they're gonna say, sorry, we don't have any tobacco products on site.
Yeah,
It's been like a cat and mouse game with trying to catch them, but in our community, that's the number one source for you to purchase tobacco products.
and that's where, in SRO, our greatest strength is our relationships and the relationships that we build and the relationships that we're able to, you know, kind of mine, so to speak, to kind of help us do our job. It's not because we wear a badge or because we carry a gun. It's because we get along well with students. We get along well with those parents, and they share the type of information to us so that we can then be that liaison and share it with excise or share it with the next group or share it with whatever task force we need to get the job done.
Yeah, I would agree on that too, and I would tell you, I don't know if you guys have an SRO at your school corporation, but if you don't, like, try to get one, because 99% of what I deal with and like what I catch isn't because I'm just walking into the bathroom and catching them on time, is because other kids tell me about it. You know, they told me about the gas station that was going on in town. They tell me about so-and-so's got this card or so-and-so's having a party, you know. They put everything on social media, and they take screenshots and bring it to me because we have that relationship. So if you can get an SRO that's good at that, they'll get that information for you and you don't have to worry about it.
Oh, yeah, I guess if everybody wants to come and check everything out, well, they can tell us what it is.